Thank you very much for inviting me to join the CS4ME Annual Global Malaria Civil Society Forum. It is a pleasure to take part in this virtual conference. For this year's World Malaria Day, WHO has joined forces with RBM Partnership, CS4ME, and other partners to amplify the critical importance of advancing health equity, gender equality, and human rights in the malaria responses around the world. Malaria is a disease that predominantly impacts on the poorest and most vulnerable. Our collective work in ridding the world of this disease will contribute to a more equitable future. I would like to acknowledge the tremendous contribution of our civil society partners in facilitating and advocating for malaria prevention and control measures, especially in support of marginalized and hard-to-reach populations. Yet, despite our collective efforts, too many people continue to miss out on the services and information they need to prevent, detect, and treat malaria, especially population experiencing disadvantages, discrimination, and exclusion. We need to strengthen and step up our efforts to support these populations. Not only it is our moral duty, it is the best way to get back on track to achieve our global malaria targets. This has been an historic year for malaria. At a recent WHO conference in Yaoundé, African ministers of health from high-burden countries committed to the goal of an accelerated reduction in malaria mortality. Equity in access to services is a central tenet of the declaration. In signing the declaration, the ministers pledged to sustainably and equitably address the malaria challenge. Ministers recognized the importance of tackling the root causes of stagnating progress in malaria control. They committed to aim of ensuring that all populations at risk of malaria consistently receive the appropriate tools, including those living in hard-to-reach areas and conflict humanitarian settings. They further committed to the mainstreaming of malaria services into primary health care as the most inclusive, equitable, people-centered, and a cost-effective way to progress towards universal health coverage. This commitment marked an important step in our journey to change the malaria story for families and communities across Africa. In Yaoundé, I was honored to participate in vibrant discussion with civil society and parliamentarians about how this political commitment can be translated into concrete actions and resources. Your dedication to the fight against malaria inspired me immensely. Achieving the goal of zero malaria in Africa will only be possible throughout the meaningful engagement of empowered and enabled communities. During the Yaoundé conference, CS4ME co-founder Olivia Ngu said, "We won't be able to beat malaria without a strong commitment from communities. Communities must be at the center of the fight against malaria." I do agree with Olivia. People at risk of malaria need the knowledge and the tools to protect themselves and each other from the disease and to overcome barriers to accessing quality services, interventions, and care. Communities can help ensure that no one is left behind. As communities, we are at the front lines of malaria responses worldwide. You have the lived experience. Identify who is missing out on malaria services and the barrier that they face to define the solution that are the best suited to the local context. As communities, you have a critical role to play in holding leaders to account, to demand a change that will result in people receiving quality health services and the appropriate mix of interventions. Your engagement with parliamentarians can lead to enhanced public investment in health so that diseases such as malaria receive adequate funding and the money is well utilized. Reaching the goal of zero malaria would make the world a fair and better place. But to do so, we need to focus on and fully engage with those who suffer most from the disease, the poorest and most vulnerable. Thank you once again for the opportunity to share these remarks. I wish you all a successful meeting.
Thank you very much, Dr. Daniel, the Global Director of the Malaria Program at WHO. Dr. Daniel is a fervent supporter of civil society organization, and he has been making a priority to ensure that communities are at the center of malaria program and no one is left behind. So thank you very much all for joining us today for the annual CS4ME Forum. And we are happy to have you all. If you can please introduce yourself. We're going to start our forum now with a presentation of CS4ME. Please introduce yourself, tell us where you're from, your country, and also please tell us one thing you want to see in the malaria fight and one thing you want to change in the malaria fight. So today we're going to have a huge day, a long day, a day full of conversations and also ensuring that we talk about what is needed to ensure that malaria programs are equitable, are based on human rights, are gender sensitive. And this theme this year is all about communities engagement. And we really hope that you will work together to ensure that we beat malaria. So we go right into the first presentation. We'll share the agenda with you all on the chat, but it's going to be a full agenda with great speaker, experts, panel of civil society organizations. I won't go through the agenda in detail, but it's a really interesting agenda today. You're going to hear from experts from different thematic area in malaria, and you're also going to hear about a panel of CSOs. So please, let's start with the first presentation, and we will share the agenda in the chat with you all. Thank you for joining us. Please get your colleagues and friends to join us as well. Yeah, so we'll go straight to the presentation now. Thank you. Thank you. Next slide, please. Thank you. So why CS4ME? CS4ME is a global civil society for malaria elimination. And in 2018, civil society organizations met together at the first World Malaria Congress. It was in Melbourne, in Australia. And we actually said that there's a need to change the way malaria implementation is going on, and that we need to learn from HIV and AIDS activists and get together, unite our force to combat malaria. So from this meeting, and I want to also acknowledge the organization who took part in this forum, the founding member of CS4ME, who were there with Impact Centrafrique, our colleagues from Asia, Dr. Champa, Shri, our other civil society members from Africa who were present at this meeting, where we announced the launch of Civil Society for Malaria Elimination. Next slide, please. And my name is Olivia. I'm the Global Coordinator of CS4ME. I'm really happy to have you all today for World Malaria Day. So very quickly, many of you already know us and some of you are new and are wondering what is CS4ME. So CS4ME is a movement of about 800 civil society organizations, and we even have more organization, because within our network, we have national networks of CSOs like ACOMIM from Nigeria, or the national network from Ghana, or the network from Cote d'Ivoire. And I see that we have our friends from Cote d'Ivoire, Ghana, Nigeria, and many countries that are already here. So we also have network of CSOs into the global network. And we have CSOs then from 48 countries, mainly Africa and Southeast Asia. So we believe that it's totally unacceptable that we still have hundreds of thousands of people who continue to suffer from a disease we can prevent and we can treat. If you look at the World Health Malaria Report, each year we are losing more than 500,000 people due to a disease that we can prevent, which is malaria, and this is totally unacceptable. So we are committed to strengthen capacity and also elevate the voices of affected communities to ensure that they can raise their voice, and they can also support national and global efforts to eliminate this disease. Next slide, please. So your role as community is very important in the fight against malaria. So our vision is to ensure that national civil society and community are recognized as bold, creative catalysts of change, are supported to drive people-centered national, regional, and global malaria efforts, and really to use the power of a global movement of civil society and community to achieve malaria elimination. So basically, we want to make sure the world recognize your local expertise as malaria actors and experts, and that we can work together, and civil society can really be the ones to catalyze the changes that are needed to achieve malaria elimination. Next slide, please. Okay, so how can you be a member of CS4ME? So our membership is open to all local civil society organization or network that are based in malaria endemic countries and that represent malaria affected communities. So if that's the case, please, you are invited to join CS4ME, and my colleagues will share the link in the chat. So we have a variety of members from emerging community-based organizations, members from religious groups, members that are Global Fund sub-recipients, CSOs. We have youth, you have women groups, we have all type of members in all the diversity, and we are very thankful for all of them to have joined the global network. And so organization can join the network, and please, if you have not, please do so. So our members, we are very proud that today we have CS4ME members in high decision-making spaces. They are in board meetings, in places where decisions are made, and they are able to share your needs and your views at that level. So we have communities delegation to the Global Fund board, where I'm part of that board. So if you have any issues with Global Fund program, please join us. Can you go back to the previous slide, please? We also have the developing NGOs delegation, CSOs at that level, and we have Mrs. Cecilia Seno from Ghana, Wato Joseph from Cameroon, and others who are part of that delegation at the Global Fund board. So they represent developing NGOs on that board. So please feel free to email us so we can share with them your concern. We have members that are at the Global Fund Youth Council. You have members that are also at the Global Fund Advisory Council, like Dr. Shampa from India. We also have Shri from Thailand. And we have many other CSOs in different partners committees, especially the RBM Advocacy Resource Mobilization Partner Committee or the Communications Committee. So you have members who are in these spaces. Please feel free to reach out to them. We're going to send the email of the Secretariat in the chat. So reach out if there are any issues that you see concerning any of these groups. Next slide, please. And also we have members that are in CCM at the country level, who are your representative at the CCM and who are here to make sure that your voices are heard. So very quickly, CS4ME strategic objective, strengthen capacity of civil society organization. And by strengthen capacity, we really mean technical skills like malaria, technical skills, because we know you are already expert in your field, but we work with other technical experts to bring all our capacity, especially in terms of new innovations in malaria, such as the malaria vaccine, malaria tools, malaria resistance, and all those new issues of climate change. So that's what we do in terms of capacity building. We also build civil society influence with Global Fund CCM, country coordinating mechanism, national malaria control program, at least in the high burden, high impact countries and others. And we also strive to demonstrate the capacity and impact of civil society in countries. And we raise advocacy, global advocacy for CS4ME. And we also advocate for more investment in civil society for malaria elimination. So in this forum today, you're going to hear about the CEO of the Global Fund, the global coordinator of PMI, many partners who invest in malaria, and we constantly tell them that it's very important to have strong investment in civil society, as well as our own Ministry of Health, Ministry of Finance of our own country to start investing more in civil society in malaria. Next slide, please. So you have the presentation, so you get to read all of it right after the webinar. So we have done a lot of capacity building trainings. We have many trainings that you can see on our website on many topics: vaccine, gender, the community-led monitoring, many topics, even including how CSOs can fundraise for their organization and their project management for CSOs. We have many trainings that are free and they are available on our website. And we also have many tools that we have developed for you that you can download on our website and you can use. We also work on national influence to support CCM members to be effective advocates for malaria and also engage in productive dialogues with NMCP. In terms of local impact, we support, learn from, share community-led initiative to overcome grassroots barriers to malaria elimination, such as community-led monitoring, community advocacy effort. And we have a regular CS4ME coffee talks where CSOs share best practices among each other. Next slide, please. So you have a range of resources and tools you can find on our website. We also do global advocacy. And speaking of global advocacy, at the moment, we are engaging in a campaign, a Pan-African campaign for civil society to sign on an advocacy letter we wrote for the president of Korea, because there will be the first Africa-Korea summit in June, early June this year. For the first time, African head of state will meet in Korea and talk about partnership. So we want to make sure malaria is at the center of those discussions. Sister from Uganda, thank you. Yes. So, can we mute Sarah from Uganda? Thank you. So thank you very much. I'm sorry. So I was saying that in terms of global advocacy, right now, we are doing a massive campaign targeting Korea head of state. And please, we're going to share the letter and the link in the chat. If you have not signed this letter, please do so, because we want Korea to continue to invest more in malaria. They are very specialized in rapid diagnostic tests and innovative tools that can really help to save lives at the community level. So we also do advocacy for investment, of course, more investment in civil society and community, and we continue to work on strengthening accountability, but also the effectiveness of the resources that are already available in the malaria fight, making sure that our country can use those resources more effectively. Next slide, please. Okay, so this is just a flyer that we will share. We'll share the links on the chat. Please join us. Please share in your countries. We want to make sure we get as many members as possible because there are so many free available resources for civil society. So please share so that others can benefit from those resources. Next slide, please. Next slide, please. Next slide, please. We're going to share all of that in the chat on how to become a member. It's very easy on our website. Look, you click and then you join us and you join the CS4ME family. Next slide, please. So I'm going to go very quickly now because those are key achievements. So that you know what we are actually doing concretely. I'll go very quick on that because you have the presentation on the slide. And we're going to spend more time listening to technical experts today. But just quickly, we have developed with many of you that are here and many partners who supported this process, the first community-led monitoring guide. So community-led monitoring is a very important initiative that allows civil society organizations independently of the health system or of the Ministry of Health and partners to really have an independent way to monitor the quality and access of services that are being given to communities and the beneficiaries. So when we talk about malaria being equitable, this is a very important tool to ensure that no one is left behind and to ensure that civil society can actually collect information on the feedback of the beneficiary. Are communities satisfied with the type of services that they receive? Are they happy with it? Are they paying a good price? Are they having issues in access to services? When they get to the facility, are they stock out? Are they able to get the malaria test and treatment free of charge for children under 5 and pregnant women or other? All those questions, you can use that tool. It's on our website to develop the community-led monitoring system in your area, in your country, and for countries that where it already exists, because like in Nigeria and other countries, there's already a strong community-led monitoring mechanism. You can join them and provide them feedback. So if you have any question about that, please email us and we will send you all the information. Yes, the guide is available on the CS4ME website. So my colleagues will drop on the chat all the links where you can find all the tools, including this one. But we really encourage you to read it and then to see how to get involved, either by setting up one system if it doesn't already exist, or by contributing to a CLM system that already exists in your country. So we look forward for you to engage in that. Next slide, please. Next slide, please. Okay, so we also have a lot of tools that we have done. There's one tool we have done on advocacy and communication. We realize it's important for CSOs to be effective advocates, to translate your message in a way that is impactful and for your audience to understand what you mean. So for that, we have developed trainings and tools on advocacy, on communication, but also on project management. And we want to thank our consultants and experts who have helped us to develop those tools. So project management, resource mobilization, how to mobilize your own resources as a civil society organization? What makes you credible in front of a partner, a donor, a funder, an investor? So we have those trainings that are available. And to access that, you have to be a CS4ME member, and you get access to all those tools as well. Next slide, please. So we'll move the slide a little bit quickly so that we can gain time. I've already talked about it. We do civil society coffee talk every quarter, so you will receive flyers, and we thank all the amazing members who are sharing their views during those different coffee talks, sharing their best practice. They are really the ones that are making those moments very, very successful. And it's very important because for the first time, CSOs from Tanzania, from Cote d'Ivoire, from Nigeria, from Asia, are able to talk to each other and share tactics, strategy, best practice. So thank you all to all of you who have contributed last year to our malaria coffee talk. You are really the ones driving this and making it successful. And we're looking forward to have the coffee talk this year, 2024. So if you want to share a good experience related to malaria that you have done as a CSOs, please email us, so we'll make sure to program you this year so you can share that experience. So on comms, we have done a lot of comms videos, tools, social media campaigns. Next slide, please. You can find all of that on the CS4ME webpage on Facebook. You can follow us, and then you see all the comms materials that we have developed. Next slide, please. And we're going to also, right after me, my colleagues will talk to you about our comms campaign for this year. And we thank all the CSOs who contribute to our global social campaign to really increase your voice. We are really proud that today we are able to see you, the heroes of the malaria fight. You are able to have visibility because you on the ground are doing a lot of work and you don't get recognized. So please use CS4ME as a platform to really make sure you increase visibility for the great work that you are all doing on the ground, and share with us what you do at the country level or at the regional level. Is very important to us. Next slide. Next slide, please. Yes, so another very important group that we have is the CS4ME working group. We have 4 working groups, and I really want to also thank and acknowledge all the members who are very active on those working groups. You guys have been amazing, really, because you are engaging in the group, you are making this group work, and you are discussing, you are taking decision. So this is really what we wanted, is for members to take ownership and to lead the work that CS4ME is doing. So we have a group that's called Country Coordinating Mechanism Working Group for all malaria or CSOs representative at the CCM who are concerned about malaria. And please, if that's the case, email us so you can join that group. We also have a CS4ME technical working group that's being put in place of members who have a lot of experience in technical topics related to malaria. And those members are consulted by partners on technical issues. For example, they were consulted by WHO on the malaria vaccine, and they really engage with partners on really technical area. We have a CS4ME capacity building working group. That group helps to define which type of training we need to do, how we need to do the trainings. And thanks to all of the members for their recommendation, which helps CS4ME to get better at trainings. And we have the advocacy and communication working group. They are working on advocacy, key messages. We're going to publish tomorrow. I mean, you're going to have a first insight to that today, but the CS4ME declaration is coming up for this World Malaria Day. Is going to be published officially tomorrow, but you get to see that today. But thanks to the advocacy and communication working group, and they've helped to improve the draft that we've done, and we think that is going to be very interesting. Next slide, please. So next slide. It takes a little bit of time because of internet. You know we are in Africa, so internet is a challenge. So thank you for your patience. Yes, so to join the working group, my colleagues will send the link in the chat, so you click to the link and you can join any working group you want. We are really looking for your contribution. Next slide. So we have a CS4ME steering committee, and I also want to thank very much all the members of the steering committee, Claude Pasteur from Congo, Sila from Guinea, Shri from Thailand, Champa from India, Mr. Ayo from Nigeria, all Tumaniel from Tanzania. Thanks to all of them. They are our steering committee members, and they met 4 times last year, and we meet every quarter, so that they help us to really guide and direct CS4ME and make sure that CS4ME include the needs that they are also seeing on the ground. So thank you very much for your engagement, and we look forward to continue to engage with our steering committee. Next slide, please. Yes, so special initiative that we've done in 2 countries, and we are going to extend that in many more countries, including Tanzania, Ghana, Cote d'Ivoire, and others. So it's the launch of the task force, the National Malaria Control Program, and CS4ME task force. It's an important mechanism to help to strengthen the collaboration between the National Malaria Control Program of the Ministry of Health and civil society. So we have the tool to set that up. If you are interested in setting that up in your country with your CS4ME members, colleague, but it's a very important mechanism because each quarter CSOs and NMCP meet to discuss the malaria situation, to discuss also what the malaria program, what activities they are planning, how civil society can contribute, and civil society get to share what they are doing on the ground, what are the needs of the communities, and they actually, it's a good mechanism for increased collaboration because we are here, first of all, to support our National Malaria Control Program and to ensure that they meet the malaria strategic objective, and ensuring that communities are at the center of the. So we look forward to continue this in Cameroon, DRC, but also extending this in a few countries this year. Next slide, please. Yeah, so we were also happy to support about 9 countries in the Global Fund malaria concept note applications. And we have done tools, workshops, activities, and we have a declaration of Cotonou, which was issued last year, a declaration that states how we want malaria concept note to be implemented for this cycle of the Global Fund 7th cycle, GC7. So you can you can see the declaration on our website, but we also invite you all to read that declaration and to tell us if what we are asking for is being implemented in the country, meaning that in Global Fund program, we want communities' needs to be prioritized, and we want the most vulnerable groups to have access to free tools. So you get to see all of that. But many thanks to all the CSOs who led this work in their countries, in Benin, Congo, DRC, Ivory Coast, Madagascar, Niger, Nigeria, and Senegal. You guys really made a huge impact that is going to affect the next 3 years of the Global Fund grant. Next year, please. Next slide, please. So next slide, please. I won't go through the detail of that. You get to see that on the website. But there are tools available that you can use even today to ensure that the Global Fund program for malaria are going well in your countries. So we have also, like I said, many webinars and tools that are available on our website on gender and human rights. We started we started a long time ago to talk about gender, human rights in malaria. So you have a lot of tools that we have developed, and then you can access that easily. Next slide, please. Okay, next slide, please. Yes, we're going to share that on the chat so that you have access to the tools, but please join us as a member. It's very important. We want your voice, and most importantly, tell us how you are using these tools. We were glad to have feedback from Tanzania, from many countries, about how they use the tool and they were able to train other CSOs in their countries using those tools. So please, also, we want feedback on how you are using the tools, because I know many of you are, and we want to give visibility to the work that you are doing. We want to post it on social media, on our newsletter, everywhere. So please share how you are using those tools. It's very important to us. We have, like I said, we have many tools that are available in French, in English, and it is for you. And we really want to make sure that you use them to strengthen your skills in malaria. And we really are looking forward to get feedback from you. So you will see we have a tool on the human rights, gender that we have developed a long time ago on malaria. So we really want you to access those tools and tell us how you are using it and what's the impact of it. And thanks to all the consultants, all the experts who work with us to develop those tools. We really are thankful for your contribution. So next slide, please. This is about the Cotonou Declaration that you get to see on the website. So this year, what we have done this year, we are already in April. It's been almost 4 months. So we're happy this year in January, like every January, we do our annual meeting to hear from you about what are your priorities, what are the key issues you are seeing on the ground, what you want CS4ME to focus on this year in terms of capacity building, advocacy. So yes, we were happy to have a very successful meeting this year, and we are working to ensure that we respond to your needs. Happy to announce that this year we're going to have special webinars on technical topic you have asked for, again on the malaria vaccine, again on the malaria resistance, on malaria new tools, new net, the new net that's out there that's very impactful in Nigeria. It's called the dual net. So we're going to have a lot of webinars this year that will respond to your need. And please, if you think about any other issues, let us know, and we will see how to accommodate and make sure that we get the expert to do the training on those issues. Next slide, please. Yes, and so what we've done this year, last month in March, there was the Yaoundé, it was a regional malaria meeting, a ministerial malaria meeting hosted by WHO. And we really thank WHO for accepting to include civil society and parliamentarians in that regional conference. And if you don't know about it, out of that conference was the Yaoundé's Declaration on Malaria, which is the next declaration after the Abuja Declaration that you all know well. So now the Yaoundé Declaration on Malaria was a declaration that our Minister of Health from malaria high burden, high impact countries signed, and they have declared that they are committed to ensure that we can get back on track in terms of malaria with strong community engagement. This is very important for us, with research, innovation, domestic resource mobilization, multi-sectoral partnership. So our minister just commit last month again to make sure we all as a global community achieve malaria goals. And we organize a forum for civil society and MPs from those countries around that conference. And from that forum, we came out with key recommendations. And one big outcome of that forum was that parliamentarians saw the work that civil society are doing around malaria, saw how CS4ME is united, is coordinated malaria voices for community, and they have decided to create the first global coalition, the first African coalition of parliamentarians to eliminate malaria. So it's called COPEMA, and it's the Coalition of Parliamentarians for Ending Malaria in Africa. In French, it's la Coalition des parlementaires pour l'élimination du paludisme en Afrique. So COPEMA was born during that forum, and parliamentarians now will want to unite themselves like us to ensure that they can follow up on the Yaoundé's declaration, to ensure it's not just another declaration. And we have chosen to join forces. So CS4ME and COPEMA will be working hands to hands closely together to increase local advocacy and to increase accountability, to ensure that the commitment and the engagement made during the Yaoundé's declaration will be followed. And I want to say that does not just concern the high burden, high impact country, but all countries where malaria are affected. You can use the Yaoundé's declaration, the commitment is made, and make your Minister of Health commit to that as well. And parliamentarians and CSOs will now join forces to increase advocacy for malaria. And we are very happy to be, that happened during our forum, our civil society forum. So we are all, as CSOs, are doing our job to increase engagement of political leaders in malaria. And we are happy to work together with them on malaria. So there's a lot of work that you will also do to help to create more accountability at the country level. So we will organize a whole webinar to just talk about that this year, about how you can get involved. You can get your parliamentarians to prioritize malaria in their countries, and you can also make sure that your government increase its own domestic resources to fill the gap, especially at the community level, making sure community health workers are fully funded, making sure that community gets the tools, increasing communication around mosquito nets and other tools that exist. So you have a strong role to play in that. And it's not just us, it's really you who are going to drive impact and help us to create that accountability. So we will organize a special webinar on that to discuss with you how we as civil society engage with parliamentarians to advance malaria and make sure that our country take more ownership and are accountable for the performance indicator of the malaria programs. Thank you. Next slide, please. Yes, so that's it. That's it for me. I'm really happy. It's a happy day because you are all still very strong, still very engaged in the malaria fight. It's been quite a while that we work together. So I just want to personally thank you, especially all the active CS4ME members, the ones who are sharing what they are doing in the country, sharing community issues, engaging in working groups, spreading the word about our training, sharing our tools, using our tools. And we are really thankful for your active engagement because you are making a huge contribution to the malaria fight and you are helping to save lives. As we speak, unfortunately, we have lost a lot of children because of malaria, and this is not acceptable. So I'm really pleading that this year, we all recommit to make sure that the children that you are seeing on the screen now, that we are able to see their smile, we are able to see them grow, and we are able to make sure that we end malaria. It's real. It's a real issue. And it's going to really take us as Africans, as people being affected by the disease, to take our responsibility, to take ownership, and for all of us and our leaders to be accountable for our own children and for our own brothers and sisters who are greatly affected by this disease. So this is our problem. It's not somebody else's problem. It's ours. And we need to take the lead and we need to fight that disease. If we don't do it, we are going to be the one suffering. It's not going to be somebody else. So malaria is our issue. Let's make sure that we take it on. And throughout this webinar, this forum, you're going to hear a lot about technical experts. You're going to hear a lot about innovative tools, best practices. Now, the impact of this forum will be after the forum, about what you do with the information that you are going to receive today. If you do nothing with that, it's going to have zero impact. But if you take that information and you do something with it, you act with it, you contact your parliamentarians, you go see your NMCP to ask them how you can help, you go to your community and ask them what issues they have in malaria, you really act and do something. That's how we're going to have the impact. So we don't want to do forums and webinars just to do forums and webinars. We want to give you the information, give you the knowledge so that you can take it and do something with it. And that's when we're going to have a huge impact. So thank you very much. And thanks to the whole Impact Santé Afrique team for putting together this beautiful presentation. And we look forward to the rest of the forum. Thank you, guys. Thank you. Yes,
thank you, Olivia, for handing over to me. I'm very much delighted to be part of this annual forum. And thank you for everyone who joined us this morning for this occasion, for us to discuss about equity and gender equality in the fight against malaria. So I will be taking you through the special activity around World Malaria Day so you can engage within your different networks and places. Thank you. Next slide, please. So on the occasion of World Malaria Day, there is a white label toolkit that has been produced for CSOs and any other partners involved in the fight against malaria. So in the toolkit, you will find social media and email banners, so you can rebrand your social media using those banners. You have filters that you can personalize for your profile picture. We will send you the link in the chat box so that you can personalize your picture. Also, in the toolkit, you have curated stories for malaria-affected community on the ground, videos, and key messages. Key messages are the ones that civil society have gathered and produced, so you can use any of them and share with the personalized filter on the occasion of World Malaria Day. Next slide, please. So for anyone, the white label just means that the communication material have been developed with a white band, so you can add your logo as you wish and rebrand the filters and give visibility to your organization using the filter. These on the right is the example of the banner you can use to rebrand your email and social media pages. By social media pages, we talk about Facebook, LinkedIn, Twitter, now known as X. Thank you. Next slide, please. For World Malaria, the two parliamentarians from the Parliamentary Task Force for Domestic Resources Mobilization in Africa are going to publish open-aid in key media to advocate for national funds to fight malaria. So the countries are going to be Senegal, Cameroon, Nigeria, Burkina Faso, Niger, DRC, and Cote d'Ivoire. This has been previously done for World Tuberculosis Day, so it's going to be the same for World Malaria Day. Next slide, please. Thank you for this year. CSOs have gathered, united, and crafted a statement to amplify the Malaria Civil Society Declaration and the voices of the communities. So the declaration will be adopted and disseminated following the annual forum. In the declaration, you will have the key civil society organization asks for more equity in malaria. The declaration is also available for review. So feel free when we will release the declaration to share it within your various networks. And we as civil society are catalyst and agent of change. So it's the occasion for us to make the voice of the community heard among our various networks. Thank you. Next slide, please. While sharing content on social media about the CS4ME Annual Forum or World Malaria Day, don't forget to use the hashtag CS4ME on your various communication. Next slide, please. Around World Malaria Day, also, if you are attending the MIM, it's the 8th Pan-African Conference on Malaria. It's a multilateral initiative on malaria. You are very invited to join the Women in Malaria event that is going to be on Friday as a side event of World Malaria Day. It's open to all participants that are actually attending the MIM, and also men are very much welcome too. Next slide, please. On the occasion of World Malaria Day, Impact Santé Afrique is launching our WhatsApp malaria channel. It's going to be a channel where credible information is going to be shared and tools that are needed for malaria elimination. So you are very much welcome to join the channel. On the channel, you have the credible information. You also have access to latest information about vaccine, about any research that is being done regarding to the malaria fight. The channel is open for local leaders and civil society or any actors in the fight against malaria. So Impact Santé Afrique is going to work with credible sources and organizations to provide you every detail you need to know in the fight against malaria. Thank you. Next slide, please. We are going to drop the link in the chat box so that you can join the channel. Also, we have some malaria tools available for CSOs, and we are going to share the links in the chat box too for those who need them. Thank you. Next slide, please. Thank you, everyone.
Thank you very much. We would share the moderation now with my colleague Fidel for gender issues to ensure that we have a gender balance webinar. Donc, Fidel, over to you, please, for the moderation of the forum. If you can introduce the next presentation until the end. But thank you so much, Ivana, for the great work you are doing.
Good morning, good afternoon, good evening, everyone. Just going to briefly give a global situation of malaria currently as a background to this annual CS4ME Annual Forum 2024, marking the World Malaria Day. Like we know, we have the Global Technical Strategy, which has set out the goals from 2016 to 2030 that continues to guide the goals and gives direction as to where we want to be when it comes to malaria control and elimination. And in that particular document, the global response was set, and the global response was set with the visions, the goals, the milestones, and the targets, and that has not changed, where the vision was a world free of malaria, and the different goals were 4 of them: reduce malaria mortality rates globally, reduce malaria case incidence globally as compared to the 2015 levels, eliminate malaria from countries in which malaria was transmitted in 2015, and to prevent re-establishment of malaria in all countries that are malaria-free. And the different milestones and we were set, 2020, 2025, and 2030. This was a global response. All countries can accelerate efforts towards elimination. Country ownership and leadership with participation of communities, multi-sectoral approach was one of the bedrocks of ensuring that this vision, this goal and milestones were achieved. Equity in access to services, especially for the most vulnerable and hard to reach populations, is essential. And innovation and tools and the implementation approaches to malaria control, intervention and elimination is also key to ensuring that these goals were achieved. Sorry, I'm trying to move my screen. However, at the first time of tracking these GTS goals in 2020, we were off track, and this slide shows in the high burden countries where malaria is still prevalent, we were completely off track. And we're in 2024 with almost less than a year to the next milestone checkpoint in 2025. And so we would see where we are as of next year. However, some of the things that have contributed to being off track included decreasing efficacy of the malaria control tools. We have resistance to the anti-malaria medicines, to insecticides. There were implementation challenges. We still have challenges with uptake and coverage of interventions, financing, though a lot of money has come into the malaria space, but this has plateaued for quite the last few years. Donor funding has plateaued and there's minimal increase in domestic financing. We also have implementation challenges around technical capacity at all levels, at country, national, district, and community, with a high turnover of health workforce, weak surveillance system, challenging implementation environments, conflicts, humanitarian crisis, and fragile settings, and of recent, more impactful now are things around climate change. We all remember the COVID-19 and the impact that it had on malaria and indeed the health system in general. And we also have emerging biological threats, new species of mosquitoes. And so these are all things that are contributing to the cases of malaria not being on track as anticipated. However, as to address this, the HBHI approach was set up, and this was targeting countries with high burden, and we wanted to have high impact, and 4 elements feeding into the tangible actions through national strategic plan implementation and concrete outcomes. And the 4 main pillars were political will, strategic information, better guidance, and coordinated response. And of course, all of these is on the bedrock of effective health system and multi-sectorial response. And we had the 11 HBHI countries where this approach was, as it were, the main approach that was used to accelerate reduction in malaria burden and indeed to accelerate towards elimination. Also, the whole point that the malaria program alone or the Ministry of Health alone cannot get us to where we should be. It should be a multi-sectoral response where you have trusted national leadership, well-functioning, equitable, and resilient health systems. So the health systems being functional, being resilient, is critical for us to achieve the goals that have been set in terms of malaria goals in the GTS. With all the efforts, the World Malaria Reports of last year still show that 84 countries and territories are at risk of malaria, with half of the world population still at risk. The high concentration of malaria cases and deaths in sub-Saharan Africa. Globally, we had 249 million cases of malaria in 2022, and slight increase, and indeed from 2021 and 2015. 94% of these cases in sub-Saharan Africa, and in terms of deaths, you have 608,000 deaths, slightly decreased from what it was previously. However, 96% of these were also in Africa. It's not all that, or let me put it this way, there have been some successes. Just early this year, Cabo Verde was certified as malaria-free. And this is a stark example that reminds us that having the right political will, strong partnership, and full commitment of every player, that elimination of malaria is possible in all settings. So we are not losing hope. It's doable, and it is possible, and it is feasible. Going forward, how do we move to get back on track? We need to promote innovation, and innovation promotion here is not just tools, but also implementation mechanisms. So we need to better anticipate for new and more effective tools. We need to innovate delivery systems for current interventions and existing tools so that we can maximize impact and prolong the useful therapeutic effective life of the tools we have, both in terms of medicines, in terms of insecticides. We need to mix and target the existing tools more strategically, using the principles of subnational tailoring and prioritization for impact. It's also key to take advantage of opportunities and lessons learned from challenges like what with the COVID response, and new delivery opportunities and mechanisms in conflict areas to ensure that those who need these interventions are reached and adequately supported. New tools. As of October last year, WHO now has 2 vaccines recommended for prevention of P. falciparum malaria in children. We had the ROTSS, which was approved in 2021, and the RO21, which was approved in October last year. Deployment of vaccines already commenced in various countries, and the availability of this second vaccine is expected to address the issues of supplies and access. So that's an additional tool in the armamentarium for controlling and indeed eliminating malaria. And also very importantly, the political commitment. We are all cognizant of the Malaria Ministerial Conference that took place on the 6th of March, which was co-hosted in Yaoundé by the government of Cameroon and WHO. You had ministers of health and senior government officials from 11 high burden to high impact HBHI countries, as listed there, including global malaria partners, funding agencies, civil society organizations, and other principal stakeholders. And the conference had 4 key aims. 1, to review progress and challenges in meeting the targets of the WHO global technical strategy, to discuss mitigating strategies and funding, to agree on effective strategies for accelerated mortality reduction in Africa, and to establish a roadmap for increased political will and societal engagement with a clear accountability mechanism. Glad to say that there is the declaration that came out of that ministerial conference, where in summary they pledged to provide stronger leadership and increase domestic funding for malaria control programs, strengthening health systems with a focus on primary health care, ensure more effective use of data for targeting, apply the latest technical guidance in malaria control and elimination, enhance coordination and multisectoral collaboration, and build partnerships for funding, research, and innovation. So essentially, they taking the pillars of the HBHI approach and making a commitment and coming out with a declaration as how to move things forward. And this political commitment and political will is very important and crucial. So in conclusion, though we are currently off track in meeting the goals and targets of the GTS, past lessons and trajectory of malaria control before 2015 is reassuring. And also with the examples of Cape Verde and countries that are moving rapidly towards elimination, like the Rwandas of this in Africa, that given the right leadership and direction, it is possible to get back on track and achieve the GTS goals and targets. So effectively deploying and maximizing current tools can already begin to get us back on track while promoting and development of new and effective tools in the pipeline. Country ownership and leadership remains pivotal. That's why the ministerial conference and the declaration from Yaoundé is key in moving the fight against malaria forward. A multilateral approach must be vigorously pursued with community involvement. We cannot achieve our goals without community involvement, civil societies, community ownership. It's key and important. So both in the design and implementation of malaria control efforts, and also funding from both domestic and international sources must increase substantially for the GTS goals to be achieved. So with this, we continue to keep our eyes on the prize, a world free of malaria. And as we celebrate the World Malaria Day this year, in 2024, let's make it one that is remarkable, where we would move the fight against malaria forward. Thank you very much.
Thank you very much, Dr. Peter Olomose. Nous avons, à travers cette très belle présentation du Dr. Peter de l'OMS, eu la situation globale du paludisme à travers le monde, avec un accent sur la lourdeur du fardeau en Afrique et en Asie du Sud. Nous espérons que cette présentation peut être très édifiante pour tous nos participants, et surtout un aspect très important sur lequel le Dr. Peter nous a édifié, c'est ce qui les communes mènent des engagements pris après la déclaration de Yaoundé. Donc nous sommes ravis qu'il ait pu partager cela avec nous et qu'on puisse rappeler et mettre à l'ordre du jour ces engagements que nos acteurs de la société civile, les partenaires impliqués doivent pouvoir suivre, pouvoir se rassurer de la bonne mise en œuvre par les ministères concernés dans les pays les plus touchés par le paludisme. Sans plus tarder, on va passer au prochain panéliste, qui est le professeur Antonio Conjo. Le professeur Antonio Conjo est chercheur à l'OCEA et il est également le président de la branche Cameroun de PAMCA. Il va nous édifier aujourd'hui sur la situation du paludisme en Afrique, plus particulièrement en Afrique subsaharienne, avec un accent vraiment détaillé sur les différentes composantes, bien les différents problèmes liés à la lutte contre le paludisme en Afrique subsaharienne. Donc, on va, sans plus tarder, donner la parole au docteur Antonio Conjo pour sa présentation, tout en le remerciant chaleureusement et écoutant sa présentation. Merci.
Thank you for giving me the floor. My name is Antonio Conjo Christophe. I'm a researcher at OCEAC Yaoundé, Cameroon. I'm also the acting president of the Pan-African Mosquito Control Association Cameroon branch. So for today, I will be entertaining you with this theme, which is malaria situation in Africa. So I hope we will try during this presentation to try to find answers to this following question. What is the situation of malaria in the world? What makes malaria burden so intense in Africa? What are the new threats? How do we address the situation of malaria? So these are a few questions that I want us to maybe go through during my presentation. So I'll start by saying that malaria remains an important public health problem across Africa. Over 200 million cases are recorded yearly, and over 600,000 deaths are also recorded yearly across the world. And 90% of these deaths come from Africa. And in addition to this, you have a high economic cost of the disease on countries. So if we look at the countries which are most affected by malaria, we'll see that the 5 top most affected are Nigeria, DRC, Congo, Uganda, Mozambique, and Niger, which clearly shows that there is a high burden across the continent. But on the other side, we also have countries where there is effort which has been done in order to eliminate malaria. You have, for example, Cape Verde, which have been able to eliminate malaria, which is now malaria-free since last year. And you have in between these two countries where malaria burden is more stable. So when we look at the morbidity and mortality of malaria, we'll see that since 2000, the morbidity and mortality was really decreasing across the world. But since 2015, we are not registering to this any decrease. The situation is more tail in most countries across, particularly Africa. So, and when we look at the evolution, here we can clearly see what we are observing, the current evolution, and what is expected to be observed. So from here, we see that the gap is increasing. And if we continue doing what we are doing, the situation will continue increasing. So this also clearly come out with the question that why is making that the situation is more intense? Why we are not able to reduce the disease? If we look at progress that we have done so far, we'll see that mortality, we have done quite good for mortality, but we have red dot everywhere, showing that there is more area where we need to improve in the fight against malaria. So these are things that are very important maybe to highlight here. So what makes malaria so intense in Africa? I would say that malaria is a disease where we have human as a host, we have a vector, and a parasite. All these 3 components are in constant evolution. So, meaning that the situation that we have today will not be similarly the same tomorrow. So, we need to update ourselves in the way we are fighting, the way we are implementing control action on the field, and also assess if there are things that could affect intervention that we are putting in place. There is also the environment which is interacting with the vector and human through social factors, environmental management, and also climate change, which are all factors which are affecting both the vector and the environment. All this is affecting diseases such as malaria, and this also need to be well understood in order for us to be able to fight efficiently against malaria. So what makes malaria so intense in Africa? We can also see that in Africa, we have one Plasmodium species which is highly dominant across the continent, which is Plasmodium falciparum. And this is responsible for over 95% of malaria cases that we have in sub-Saharan Africa. And this parasite is originated from Africa and has expanded across the continent, as you can see in the map here. Now, we also have the high diversity of vector population across the continent. Over 154 anopheles species are found in Africa, with over 26 of them which are vectors. And now, when it comes to major vector, we have 6 species which are responsible for over 95% of malaria transmission across the continent. We also have secondary vectors which are between 15 and 20, which are also associated with malaria transmission in different epidemiological settings and which happen to contribute quite frequently in malaria transmission. Another factors which makes malaria quite complex or diverse in Africa is the complexity of the vectorial system, meaning that as we identify the major vectors, these major vectors belong to complex of species or groups of species where you have many species, 4 to 8 species, with some of in this complex which are not vectors. And we really need to know in each of these complex which species is vector and which is not, because this species resemble themselves morphologically. And if you know that this species is not a vector, there will not be any sense for you to put in place more effort for controlling the vector or more resources to control this vector, why it's not a vector. So knowing if in a certain environment you have a vector is very important for you to, and it also guide you on the way you're implementing control intervention on the field. And there is also the capacity of vector to adapt to different environment. As we can see, Anopheles are mosquitoes which mainly breed in sunny water collection exposed to sunlight. And we have Aedes who breed in containers and Culex which breed in polluted habitat. But now on in Africa, we are seeing Anopheles which are also adapting to different type of habitat. They breed in containers and polluted water. So this information is also very crucial for us to take into consideration when we are planning to fight against this vector, because if we neglect this type of habitat, we can still continue to witness the presence of mosquitoes and transmission of malaria in different places across the continent. We have also the change in the biting and resting behavior of vectors from indoor to outdoor, making that if in an environment we doesn't know if our vectors are biting in on outdoor, this could affect the way we're implementing our intervention. And now in Africa, we have the situation with many vectors which are involve malaria transmission, some biting indoor, some biting outdoor. It makes that not one intervention will be highly efficient against this vector. So we need to have this information quite well in order for us to be able to know how to target and fight efficiently against vector population. There is also in Africa transmission which is due by many vectors which replace one another during the year. So this vector will have different behavior, different biting behavior or different resting behavior. So having this information will permit you really to know when to implement a certain intervention and if one intervention is suitable for one vector or not for another, and know how to fight efficiently or maybe push the information to the population so that they can be able to fight efficiently against this vector population in their different localities. So this is also something which is also affecting making malaria transmission intense in Africa. In addition to the fact that we have different vector species which could replace one another during the year, we also have a situation where these different vectors act simultaneously in transmitting malaria. This is also witnessed particularly in the equatorial forest region, where you have 3 to 4 species transmitting malaria together in an environment. And this information could help to know to fight malaria. And this explains why sometimes it is difficult to control malaria, or why malaria is highly resistant in Africa, because we have a situation and one intervention will not be efficient for controlling vectors in this type of situation. We also have the rapid expansion of insect resistance, which is expanding across Africa and which is affecting vector population. And we have also the multi-resistance profile of vector population, making them to resist to different type of compound. All this information is important to capture to know how to fight against vector population. New threats are also coming in, such as the climate change. Climate change, through the increase or change in rainfall pattern, increase in temperature, and extension of floating area, are providing new environment, more habitat for mosquitoes. And we know that with the increase in temperature, vector population, mosquito develop quite fast. So the number of cycle of mosquitoes during the year will be more important than if the climate was quite lower, if there was no climate change. So all this is making that we are more exposed with climate change to mosquito-borne diseases and to the transmission of these diseases. So it is very important for us to monitor how climate change is affecting disease burden and how we can also mitigate the impact of this in different epidemic settings. We also have new threats which are also coming in Africa with Anopheles, a new species such as Anopheles stephensi, which is a mosquito which originated from Asia and which has now come into Africa. This mosquito was responsible for the resurgence of malaria in Djibouti and is now expanding in all places, in most countries in Africa. And there is a need for us to really understand where this vector is present, because this vector adapt to different type of habitat, and knowing where if this vector is present and how to fight the vector in different environment is very important in order for us to assist the National Malaria Control Program to fight efficiently against this vector population. We have also unplanned urbanization. We know that Africa is a continent which is rapidly evolving, and we have this high migration of the population from rural area to urban environment. This rapid development of city, which is done through poor planning, instability, development of slum, poor hygiene and sanitation, is creating more environment for vector to breed in and to transmit malaria. So we have more vector in urban environment, urban cities, making that malaria is present also in the urban environment. So these are things that we also need to capture and see how we can fight against this. So in conclusion, I will say that a better understanding of vector and parasite dynamic, human influence, environmental and climatic influence, and nutrient are very important for malaria elimination in Africa. So we need really to master this in order to achieve the elimination of malaria in Africa. Thank you again for giving this opportunity to explain to you the session and why malaria is so intense in Africa.
Merci beaucoup, Dr Antonio, pour cette très belle présentation et surtout pour vous être attardé sur comment se transmet le paludisme, surtout dans la zone endémique. Ce sont des éléments ou des aspects qui ne sont pas toujours très bien connus par nos communautés vulnérables, et il était important de pouvoir attirer l'attention de nos participants sur cet aspect très important et de pouvoir présenter quels sont les challenges actuels que nous rencontrons dans la lutte contre le paludisme, particulièrement en Afrique. C'est le cas, par exemple, du changement climatique qui affecte énormément les programmes mis en œuvre dans le lutte contre le paludisme, le problème de multirésistance aux médicaments, aux insecticides. Tous ces éléments sont vraiment des problèmes majeurs et, si je peux dire, je ne vais pas dire innovant, mais quelque chose de nouveau pour la lutte et pour les programmes de lutte contre le paludisme en Afrique. On va sans plus tarder enchaîner directement avec une autre présentation, toujours du Dr Antonio, qui va nous édifier sur un autre aspect de la lutte, en s'attardant principalement sur la lutte et l'élimination du paludisme en Afrique. Donc, je vais sans plus tarder passer la parole une fois de plus au Dr Antonio pour sa présentation.
Okay, thank you for giving me the floor. My name is Antonio Conjo-Christophe. I'm a researcher working at OCEAC Yaoundé, Cameroon. I'm also the acting president of the Pan-African Mosquito Control Association Cameroon branch. So my presentation will be on vector control and malaria elimination in Africa. Here, during this presentation, I will mainly go through what we have done so far and what lesson could come up from this, what have been done so far, and how we can use it in order to improve the way we are fighting against vector population and fighting against malaria, eliminating malaria. So I want to start with this the person who discovered the DDT, which is a up to the 1960s for the fight against malaria. So after the discovery of this compound, DDT, it was successfully used for the fight against malaria in the Pacific, and it was also used to eliminate malaria in Europe, particularly in Italy, and also to fight against the typhus fever in Europe. So having been able to get the success in Europe, the World Organization thought that we need to maybe try this compound also in Africa and see if it could work. So they did a certain number of studies across Africa, different countries across Africa, to see if by using DDT and compound which are close to this DDT, we can achieve elimination in Africa. And at the beginning of this eradication campaign, which were conducted across Africa, there was success which was recorded in most part of the continent with the significant reduction of malaria morbidity, mortality, and transmission. And this makes this program to stop at a certain point because they thought they have achieved the goal that they were set to. But after the program was dead, transmission came back. All this tell us that implementing control intervention in Africa will need to be sustainable in the way we are implementing intervention in order to make sure that we are really able to achieve elimination. And also, other factors is that we have to understand well the epidemiology of malaria on the continent, vector behavior, in order to make sure that we achieve the elimination, because these resolutions of malaria in different places were due to the fact that many of these parameters were not assessed, and we had this rebound of malaria situation. Nowadays, what we are using is mostly implemented bed net and indoor residual spray. These, particularly bed net, are used largely across the world. Over close to 3 billion net have been distributed across the world for the fight against malaria. And these two interventions were really successful in reducing the burden of malaria between 2010 and 2015. So 1.2 billion of cases of malaria were prevented using this tool, and over 6.3 billion deaths were prevented also, clearly showing us the impact that this tool had in the control of malaria in Africa and in the world also. But now, if we look at this graph, clearly showing us the trend in malaria, we will see that before, when this large mass-scale campaign of distribution of bed net were conducted, this was associated with low ownership, low user rate, and low insecticide in most parts of Africa. But still, we're able, using this mass scale of bed net, to have a significant reduction of malaria morbidity and mortality. But nowadays, despite the fact that there is this mass scale distribution of bed net, which is still going on across the continent, and there is also now a high ownership, we have increased the ownership rate and the usage rate of bed net in most communities. We have also high insecticide resistance, which is appearing. We are not able to reduce malaria cases. So all this clearly shows us that something is taking place, and that control intervention that we are putting in place are no more working as we were expecting them to work. So there is a need for us to really rethink the way we are fighting against vectors in different parts of Africa. So there are challenges which are associated with insecticide and insecticide resistance. So we have limited number of insecticide, and we also have a resistance, insect resistance, which is appearing across the continent, and which is also impeding control effort. We have a change in vector feeding and molesting behavior, which is also affecting control intervention that we are putting in place to fight against vector population. So according to the Global Elimination Strategy 2015-2030, we need by 2030 to reduce the burden of malaria. This includes malaria mortality and malaria cases by over 90%. and also increase the number of countries which have eliminated malaria. But when we look at the goal, the trend that we are observing nowadays, we see that we are far from this goal. So are we, with what we have as control intervention, be able to achieve malaria elimination? This clearly shows us that we need innovation in our intervention in order to achieve the elimination of malaria in Africa. So we have new insecticides now, which are now being produced. And these insecticides have as innovation the fact that there is a long residual effect for the insecticide, and there's also high efficacy of the insecticide against resistant mosquito. We believe that with these new insecticides, which are now being released on the market, it will help in the fight against vector population. But this is an indoor-based intervention. We also have new nets, which are also being produced with clofinapi pyrethroid treated bed net, which is now recommended, highly recommended for the fight against vector population in most parts of the world where there is insecticide resistance, which is highly impeding controlling for. So this bed net with other bed net, PPO bed net and periproxifen bed net are also now available and could also be used in the fight against vector population and improve. So there are these improvements which have been done in order for us to be able to fight efficiently against vector and the threat of insecticide resistance in most parts of Africa and the world. Also in larvicide that we are using to fight against vector population. There are new larvicides which are also being produced, such as Spinoza, which were not used before in the fight against vector population. There are also combination of insecticide and new formulation of insecticide, which are also coming in, which could also be helpful in the fight against malaria vector in different cities where this intervention could be suitable for fighting against vector population. So there is a need for us to also look for ways of using these where they are suitable for fighting against vector population. We also have environmental management with permanent changes in the environment or temporary changes, which are also very important. They show very promising information in the fight against vector population before, and we need to continue using this tool in the fight against vector population. There are also new ways of managing the environment, which could also permit us to reduce the production of breeding habitat for mosquitoes and increase the fight against vector population. And this is also something that we need to take into account in the way we are fighting against vector population. Housing improvement is also another point where we need to continue building our capacity and also improving the way we're putting this in place in order to fight against vector population. There are now new window screen which could also be used, if choke, which could also be added in houses in order to improve the fight against mosquito coming indoor to bite people and to transmit malaria. So these are new innovations that are also being provided to us in order to fight efficiently against vector population. There is also genetic control, which is now expanding and which is being used for fighting against vector population. Concerning the sterile insect technique, is not largely used for the fight against vector population, but it has been proven to be highly efficient when used for Aedes, to control Aedes population in different parts of the world, and also for other pest species across the world. And there is also incompatible insect technique using Wolbachia, which is also expanding and is being used to fight against mosquito population. And this has produced very interesting data when it was to control dengue and Aedes aegypti in Brazil and also in Indonesia, clearly showing us that the genetic control of vector could also be another important tool that we can take over to accelerate the fight against the elimination of malaria in Africa. There's also genetic control using gene drive, which is also very important in our way of we are fighting against vector population. So gene drive is that we modify mosquitoes in the lab, and we release some of these mosquitoes in the environment, and these mosquitoes which are released in the environment will mate with the natural population, and this could lead to the replacement of the population or the suppression of local population, stopping by then the transmission of the disease. This is still being conducted in the lab, and there are not many trials which are conducted on the field. So these are also new interventions that we also need to take into consideration in the fight against malaria, in the elimination of malaria in Africa. So there are new vaccine which have been produced. You have the RTS vaccine and the R21 vaccine, which is used mostly for children, for protecting children against malaria, and which could be very important asset in the fight against malaria, in the elimination of malaria in Africa. And we also need to take this in consideration for the fight against malaria in different epidemiological settings. In Cameroon, this vaccine is now being rolled out in over 40 districts and is providing very good data concerning the protection of these children and the fight against malaria in this setting. So there are many countries across Africa which are also taking this on and improving the fight against the disease. So as a final point concerning this point, I would say that we need to put in place integrated vector management. Integrated vector management means that not one intervention will be successful or suitable in all epidemiological settings. So we need to bring intervention which are suitable in different, which could be suitable for controlling malaria in specific environment in order for us to have this elimination of malaria. And also integrated vector management means that we need to bring all actors which are involved in the fight against vectors in order to make sure that we doesn't leave anyone out of the fight against this disease on the continent. So now that malaria partners are now saying that they doesn't have much fund for malaria in the future, we need to look for local funding to support malaria. So if this looking for local funding for malaria could be an opportunity for us for developing industries, for the production of bed net, for the production of drugs, for the production of RDT tests for controlling malaria, for the use of plant or other compounds that are used in our environment, or also for developing our capacity, research capacity, institutional capacity in the fight against vector. I think this could also be a great opportunity, and we need to take this as a great opportunities for us to fight efficiently against malaria and to develop capacity which were not developed in most countries in Africa. So looking for national funding, national fund to support the fight against malaria could help us be sustainable in the way we are fighting against disease and other vector-borne disease on the continent. So this is what I have for you today again. Thank you for listening.
Thank you so much. Thank you so much, Dr. Antonio Konjo. C'était vraiment très édifiant cette présentation sur les grands aspects de la lutte contre le paludisme et surtout comment il faut aller vers l'élimination du paludisme en Afrique, qui est le continent le plus touché par cette pandémie. Donc, à travers sa présentation, le docteur Antonio Konjo est revenu en détail sur les grandes interventions de lutte contre la maladie et surtout quelles sont les innovations qui nous tendent la main dans la lutte contre le paludisme pour les années à venir. Et à cet aspect de cross-coaching dans les différentes interventions, il y a les différents sectoriels qui peuvent intervenir pour pouvoir lutter plus efficacement dans le contre le paludisme. On pense ici au ministère de la Santé publique, au ministère de l'Environnement, de l'Agriculture, Travaux publics, pour ne citer que ceux-là, qui doivent travailler ensemble, d'où l'importance de l'engagement sectoriel. engagement multisectoriel plus précisément, afin de se rassurer et de s'assurer que tout le monde se sent concerné par la lutte contre le paludisme au niveau pays. Donc, nous remercions énormément le docteur Antonio Conjo pour sa présentation et on va de ce pas aller faire un petit break avec une vidéo des femmes, les femmes engagées dans la lutte contre le paludisme qui vont nous faire passer leur message à propos qui a été filmé lors du la dernière journée mondiale, la dernière journée internationale des droits de la femme. Merci.
Le paludisme affecte les femmes enceintes et les enfants de moins de 5 ans.
Les femmes sont un enjeu majeur dans l'élimination du paludisme, aussi bien au Cameroun, en Afrique que partout ailleurs.
So fathers are partners in all of this, but it's really mothers who are taking the strongest role in the fight against malaria when it comes to the children.
Le paludisme ne sera vaincu que si les initiatives entreprises permettent aux filles et aux femmes de jouer un rôle prépondérant dans la prise de décision et la mise en œuvre des actions au niveau décisionnel, au sein des communautés et dans les familles.
They are more likely to die if they get malaria.
Et j'ai une nouvelle pour vous qui est très importante, c'est que le paludisme peut être éliminé. Mais comment est-ce que nous pouvons faire, nous femmes leaders, nous jeunes filles leaders?
It's really important when we're developing new tools, new drugs, new vector control tools that we think about the role of women in how those tools are used, whether we're using the right type of dose for women, whether we're developing drugs that women can use in pregnancy.
There is no fight against malaria without women, and we need women at the table, we need women leading, and we need women everywhere in the fight so that we can eradicate this disease.
Ensemble, œuvrons pour une représentation accrue des femmes dans les instances de prise de décision qui influent directement sur leur santé.
Nous remercions vraiment toutes les femmes engagées dans la lutte contre le paludisme et nous remercions toutes les femmes engagées dans la lutte contre le paludisme et surtout cette très belle vidéo qui a été montée lors du dernier forum, du dernier forum régional des parlementaires de la société civile à marge de la réunion des ministres de la Santé engagés des pays les plus touchés par le paludisme. Dans la suite de notre agenda, nous allons passer la parole à un keynote speaker et pas des moindres. C'est M. Peter Sands, le directeur exécutif du Fonds mondial, qui a un mot pour la société civile et les communautés vulnérables au paludisme. Donc, nous allons sans plus tarder passer la parole à M. Peter Sands pour son mot pour la société civile. Dans 1 minute, s'il vous plaît.
Ouais. Et n'hésitez pas à mettre vos questions dans le chat. Vous avez écouté professeur Antonio. Si vous avez des questions dans le Q&A ou dans le chat, ils vont vous répondre après le forum. Donc, on va envoyer une fois réponse aux questions après le forum. Merci.
Merci. Nous allons passer la parole à M. Peter Sands.
Hello, everyone. I'm sorry I can't be joining you on this very important day, World Malaria Day, and at this great event that you're holding. Unfortunately, it coincides with the Global Fund board meeting in Geneva. Yet I didn't want to miss the opportunity to speak to you, even if by video, because I do think we are at a critical point, a critical inflection point in the fight against malaria. But before I talk about the challenges we face, I want to acknowledge how much progress we have made already and the fantastic contribution that civil society and communities have made in achieving that progress. Since 2002, the Global Fund Partnership, the combination of governments, private sector, health workers, civil society, communities, technical agencies, other development partners, have reduced malaria deaths by 28%. That's a massive achievement. And it's even more an achievement when you consider that because of population growth, malaria deaths would have gone up by something like 90% without all the efforts that we have collectively made. And the scale of what we are doing together is impressive. Just taking 2022 as an example, together we distributed 220 million mosquito nets and some 321 million suspected cases of malaria were tested. Some 37 million children received seasonal malaria chemoprevention, and almost 15 million pregnant women received preventative treatment for malaria. And 165 million cases of malaria were treated. I mean, these are very impressive numbers of working at scale to fight this terrible disease. And they're the result of country-led programs involving national malaria programs, other technical partners, and critically, civil society and communities to ensure the interventions reach the people who are most in need. Yet we are at this critical inflection point right now. In fighting malaria, we face the challenge of resistance, both vector and parasitical resistance, of climate change, which is changing the epidemiology of the disease, and of conflict, which is prevalent in so many of the places in which we see most malaria, and which both raises the costs of every intervention and makes it more difficult to provide timely case management, which is so critical to avoiding deaths. And so in too many parts of the malaria world, we are seeing not just slower progress, but actually reversals. And that must be an imperative for all of us to redouble our efforts to get back onto a strong trajectory of reducing infections and of reducing deaths. And we do have, on the positive side, actually some powerful new tools. Obviously, there's been lots of talk and enthusiasm about the vaccines, but also incredibly important, the new dual active ingredient bed nets, which we are seeing being rolled out right now, and which for just 70 cents more give 50% better protection than the conventional standard nets. And the pipeline of new tools doesn't stop there. It includes new tools to counter artemisinin resistance, to counter some of the challenges we face on diagnosis, and also further out other vector control and instruments and things like monoclonal antibodies. So together we must work out how to reverse the stalling, the reversals in the trend of the fight against malaria, and make best use of the tools that we have. In doing that, I would highlight a few imperatives. First, we need to ensure that we mobilize more resources for the fight. The fact that total resources for malaria are only a little over $4 billion is kind of shocking. That's less than the budget of a large hospital in the United States, a single hospital, for a disease that affects so many people, so many hundreds of millions of people in the poorest communities in the world. Raising more donor funds for malaria is going to be challenging given the many competing demands, but that's not a reason for not making the case, particularly when it is so clear that malaria is being exacerbated, is being made even more dangerous by climate change. And we must also leverage other sources of funds, the private sector, domestic resource mobilization. I recognize that many of the countries most affected by malaria are desperately poor, but there are also those that could be doing much more than they currently are in the fight against malaria. So we need more resources. We also need to ensure that every dollar we spend on malaria is spent to maximum impact. And that means being very rigorous around the optimization of resources across the different tools that we have, reflecting the epidemiology of particular parts of countries. We need the subnational tailoring, and we need very thoughtful use of different tools, which is driven by evidence, scientific evidence, and real assessment of value for money, not by sort of political preferences or fashion. And third, and here you play an absolutely irreplaceable role, we must ensure that the money and the resources and the interventions and services get to those who need them most, those in the poorest, most marginalized communities, most exposed to malaria. And that's where our partnership is absolutely crucial, because we know that all too often that resources don't actually get to those who need them most. And that is what we absolutely have to make sure happens, that it does actually work. So I am sorry not to be with you, but I want to thank you for your amazing work for the people most at risk from malaria. And I want to wish you all the best for your discussions around how to enhance and strengthen our response to this terrible disease. And please do get to answers on those 3 points. How do we mobilize more resources? How do we optimize our tools and interventions to reflect the differential epidemiology in different contexts and make the best use of every dollar? And how do we make sure that the services, the tools get to those who need the most? So thank you.
Merci beaucoup à M. Peter Sant. Ah, ok, là, on me voit maintenant. Nous voulons vraiment remercier beaucoup M. Peter Sant pour son mot très important sur l'importance du travail effectué par la société civile, par le paludisme, et surtout pour les communautés vulnérables, pour leur implication dans la mise en œuvre des programmes. Il est important qu'on puisse vraiment de plus en plus impliquer ces populations qui sont les victimes de la maladie dans la mise en œuvre des programmes qui sont implémentés dans les pays endémiques par le paludisme. Donc, et la société civile a ce devoir de pouvoir accompagner, de pouvoir représenter ces populations vulnérables afin qu'elles puissent bénéficier de manière, dans la mesure du possible, de toutes les interventions implémentées dans un pays afin de réduire le nombre de cas de paludisme et nous espérons d'ici 2030 éliminer le paludisme. Cela passe par une action forte de la part de tous, à travers la mobilisation des ressources, à travers le suivi communautaire des interventions que nous menons dans les pays, à travers la participation dans les instances de prise de décision. Donc, nous espérons qu'à travers ce message très important de M. Peterson, nous, acteurs de la société civile et les partenaires impliqués dans la lutte contre le paludisme pourront être encore plus actifs, répondre plus présents, pouvoir apporter aux populations vulnérables les réponses qu'il faut dans la lutte contre le paludisme. Sans plus tarder, je vais passer la parole au prochain panéliste qui est Madame Abena. Elle est Associate Director Advocacy and Medicine for Malaria Venture. Elle y est depuis 2018 et elle va nous entretenir un peu sur comment réduire le paludisme chez les femmes enceintes à travers l'approche genre. Donc, nous avons été vraiment très honorés d'avoir cette présentation qui montre une approche différente, une approche innovante qui n'est pas toujours prise en compte dans le cadre de la lutte contre le paludisme et surtout pour une cible qui est l'une des plus vulnérables au paludisme. Donc, sans plus tarder, je vais de ce pas passer la parole à Madame Abena pour sa présentation.
So thank you very much, everyone. I'm really delighted to be given this presentation. I just want to start by saying big thank you to civil society everywhere, actually, especially those in sub-Saharan Africa for this piece of work, because you have been very instrumental in getting access for malaria interventions to pregnant women in sub-Saharan Africa, and we honestly could not have achieved what we had without your support. So we're really grateful for this. So I would like to just begin my presentation is on saving the lives of pregnant mothers and their born children from malaria. And the first part of the presentation is actually going to talk about work done together with the RBM partnership to end malaria. So that's they have the Malaria and Pregnancy Working Group. And maybe just to give you a bit of a background about malaria and pregnancy. So every year, tens of thousands of pregnant women die because of malaria and pregnancy around the world, and especially in sub-Saharan Africa. In sub-Saharan Africa, actually about 13 million pregnant women contract malaria every year. And the reason for which this is very important is the fact that the babies that are born out as a result of this are either born with low birth weight, which could then result in later in their lives with mental issues or cognitive issues. So their learning and growth progress is actually slowed down as a result of malaria that their mothers had when they were pregnant. What we do know is that an intervention known as intermittent preventive treatment for malaria and pregnancy, when a pregnant woman takes it starting from the second trimester of her pregnancy, and she has to take it at least 3 times during her time of being pregnant, has actually been proven to save lives. The challenge, though, is that even though we know that this intervention exists and it's offered as part of the antenatal care practices, only just 2 in every 5 pregnant women actually receives the recommended 3 doses. So what that means is that about 60% of pregnant women are actually left unprotected from malaria in pregnancy. So this is actually a very big issue. IPTP, or the intermittent preventive treatment, actually should go along with, being protected by a bed net, etc., and also attending antenatal care. So one thing that we also want to call out here is the fact that malaria in pregnancy, especially when a girl gets pregnant or an adolescent gets pregnant, is even more severe because they have not developed any immunity to malaria during pregnancy. So older women are actually better protected or are less affected by malaria when they're pregnant than adolescents. So it's actually worse for adolescents. The challenge is that most of the time, because of the stigma attached to pregnancy during the adolescent time, pregnant adolescents will not report that they are pregnant to forgo ANC services. So what we did, this issue was actually discovered quite early on, and the first campaign was actually launched in 2005. And in 2005, just only 2% of pregnant women received IPTP. So you can think of it that if you had 100 pregnant women, only 2 of them were actually receiving IPTP or were being protected. So in 2015, the Malaria Pregnancy Working Group launched a campaign to increase coverage for IPTP because we wanted to see more pregnant women protected. Since that time, actually, the uptake of IPTP, over 36 countries in Africa have actually put in their policies and in their malaria programs that IPTP is a core intervention for pregnant women. So they are offering this and they're making it a core intervention. What we've also done as an organization from MMV is that Medicines for Malaria Venture, which is the organization I work for, is actually an organization that produces medicines for malaria. One of the main groups we have is pregnant women, and we've supported 3 local manufacturers based in Africa to scale up the production of IPTP and to get it quality assured. So what you may notice is that for Africa, many of the medicines that we actually have in our health systems are actually procured by the Global Fund or by UNICEF, and they need to be quality assured. And so MMV has helped 3 manufacturers get this assurance so that they can then supply to the health systems. So we did make some progress from 2015 to 2020. It moved from 2% to about 32%, which meant 1 in every 3 pregnant women was receiving IPTP. What then happened is that it stagnated, and so we didn't see much of an increase between 2020 onwards. So we launched another campaign. This campaign was started in 2020 and it's called the Speed Up, Scale Up IPTP campaign, which meant that we wanted countries to take up IPTP a bit stronger so that more pregnant women will be protected. So the campaign was actually a signature campaign where we called on civil society leaders within the continent, influencers to sign up for it so that we could present this to the presidents, to the heads of state, to first ladies, so that they would then be the main influencers for uptake for IPTP. And also that they would also support women to gain early ANC attendance, or they would go to antenatal care much earlier. So what we've done during this time is that organizations like CS4ME have supported with this campaign. Speak Up Africa have also supported, and several other organizations, just to get the word out there. At the end of the 2020, at the end of actually 2021, sorry, we had over 1,000 people having signed onto the campaign. And so for the 2022 African Union Congress, we presented these signatures to the African Leaders Malaria Alliance so that they would present to the heads of states that were coming to the meeting. And then also last year, we presented it to 2 first ladies, the First Lady of Ghana and Liberia, and then delegates of the First Ladies of Congo, who also came to the UN General Assembly event in New York. And we actually had Olivia Ngu, who's heading the Civil Society for Malaria Elimination, also speak at this event. So this is what has been achieved. We had many influencers, supporters. That's the First Lady of Ghana on the right side of the screen, Rebecca Kufuor, Angelique Kidjo, and Mariah Kerwin Rocks, who was previously with the Global Fund. All of them supported this campaign. So just to move on a little bit, what we're hoping to do beyond this signature campaign is that we want a country to actually carry on the initiative. So we selected Liberia, which, like I said, the First Lady of Liberia supported the initiative at the UN General Assembly event. And Liberia was actually very keen to start up. So we're in talks with the National Malaria Program of Liberia to launch this advocacy pilot within Liberia. We're hoping that adolescent girls would be the most impacted by this so that they would be even more protected from malaria and pregnancy. We're also hoping that messaging for malaria and pregnancy would be strengthened and that there would be greater advocacy within the communities that are not taking up IPTP the highest. So this is what we're hoping to get out of this pilot in Liberia. And then hopefully at the end of that pilot, it would be scaled up in other African countries if possible. Now I want to talk about a second initiative that MMV is actually piloting. So beyond IPTP uptake, we also realize that treatment for pregnant women, actually malaria treatment, is actually very, very limited. Like I said, IPTP is only taken from the second trimester. So there's nothing actually to protect pregnant women during the first trimester. And pregnant women, we all know that malaria affects children under 5 the highest. But what we don't often know is that pregnant women are actually the next affected group. And that although there's several medicines for children and other groups, for pregnant women, there isn't a lot out there. And the reason for this is that most medicines cannot be tested on pregnant women. And so the challenge is that because they can't be tested on them, they can't be proven to be safe for them. So Medicines for Malaria Venture actually realized this gap, and we decided that we were going to advocate for pregnant women to be to actually take part in clinical trials and also to be able to actually provide data. So we launched an initiative called the Malaria in Mothers and Babies Initiative. There are several pillars to this initiative that I'll talk about later. Another group that I also want to talk about is that pregnant women who also then may have actually contracted HIV. So the challenge is that these pregnant women cannot even use IPTP at all. And so we also need to produce new medicines for these pregnant women. So what we actually, these are the pillars of the Malaria in Mothers and Babies initiative. The main thing we want to do is we want to broaden access to currently used antimalarials for pregnant women. We want to invest in new molecules being developed so that new medicines that are actually safe for use during pregnancy would be developed. And then we also want to be able to collect more data on how actually antimalarials work within pregnant women. And we're also working across continents for greater inclusion of women of childbearing age. So some may be pregnant, some may not be pregnant, that they would provide data on what's the impact of antimalarials in their body. So we're actually not talking about women taking up antimalarials. We're not talking about a clinical trial where they take in antimalarials, but if they've already taken antimalarials as a result of contracting malaria, then they actually provide data on what that meant for them on a physical point. So from the regulatory standpoint, what we're doing is that we've already worked with the European Medicines Agency and the American Food and Drugs Administration. We're working with them to change their policies on how pregnant women are perceived for clinical trials. And in this case, what we're doing is that if we believe that a medicine could be taken by pregnant, if they could be included in trials, then we will talk with these agencies. They would run it through ethical reviews committees. And if pregnant women can be included, then they're included earlier on so that medicines that are useful for them can be produced. We're also, the other challenge is that collecting data on pregnant women has taken a long time. So what this slide is actually showing is that for the development of a medicine in general takes up to 25 years. Now, for a pregnant woman, collecting data can start from year 10 to year 25, which means if we don't take care, if we don't actually do something quicker, it would take almost 15 years for a medicine that is safe for pregnant women to be developed. And we want to really shorten this timeline. So what we're doing is also closing the knowledge gap. Like I said, we want to collect data on exposure of medicines on women who may be pregnant or have been pregnant. So we've developed pregnancy registries. So pregnancy registries are actually just data points where pregnant women would go and say, I've taken an anti-malarial and this is the impact that it had on me. So this is not really a clinical trial at all. It's just a woman reporting data on what has happened to her. I'd like to say that actually there was only one, before this project was started, there's only one pregnancy registry in Africa. And we've actually opened 2 others. So this in Kenya and Burkina Faso. And pregnancy registries are just not meant for just anti-malarials. We can use the registries to collect information on use of many other drugs. So for instance, for cancer medication, for diabetes medication, for chronic illnesses. So they're actually there to strengthen the health system in general. So even though we're hoping to collect data on anti-malarials, they're going to be used much broader than for just malaria. And what the data that we get will be used for is to present evidence to WHO on medicines that are in the market. Are these safe for pregnant women or are these not safe? And what kind of profiles of medicines would then potentially be safe for pregnant women or not? So for this project, we're working with several different groups of people. We're working with the product development partnerships like DNDI and others. We're working with ethical review boards. We're working with industry, bioethicists, community groups, etc., just to all advocate and share that pregnant women, we want to protect pregnant women through research. So it's not that we want to protect them from research, but we actually want to protect pregnant women through research. So the impact of all of this so far is that we've been able to speed up evidence generation for anti-malarials for the first trimester of pregnancy. We're also trying to produce safety data, and we're also paving the way so that there can be quicker assessments for medicines in general, and we're trying to build capacity at the national level. So this is the end of my presentation. Thank you very much. I assume there'll be lots of questions, and I'm happy to take any questions that will come on later. Thank you very much.
Un grand merci à Madame Abena pour sa présentation sur vraiment sur cette approche innovante sur le genre dans la prise en charge du paludisme chez la femme enceinte. C'est pas quelque chose qu'on voit tous les jours. C'est pas quelque chose qui est appliqué tous les jours, et nous sommes très heureux qu'elle ait pu partager avec nous vraiment cette stratégie qui est de plus en plus mise en avant par MMV, et pouvoir échanger avec elle sur cet aspect de l'approche genre dans le lutte contre le paludisme, et surtout pour les femmes enceintes, c'est quelque chose de vraiment innovant. Nous espérons que les programmes, à travers les programmes des pays les plus touchés par le paludisme, pourront mettre en pratique cette approche pour pouvoir mieux faire reculer le paludisme, surtout auprès de cette cible très vulnérable que représente la femme enceinte. Nous savons, très chers participants, que vous avez énormément de questions à poser. S'il vous plaît, nous vous prions de poser toutes vos questions dans le chat box. Elles seront répondues par les différents speakers au moment opportun. Donc, n'hésitez pas à poser toutes vos questions dans le chat box ou dans le Q&A. Elles seront transférées aux différents speakers et répondues. Puis, nous allons revenir vers vous avec les réponses aux questions posées. Sans plus tarder, nous allons passer dans la suite du programme. nous sommes toujours dans la thématique de le paludisme et le genre. Et nous allons donner la parole à un expert du Fonds mondial, Dr. Scott Filler, qui va nous édifier sur comment assurer la prise en compte du genre dans les programmes de lutte contre le paludisme et surtout quelle est l'approche que le Fonds mondial prône dans ce sens-là. Donc, nous allons, cet expert qui a énormément d'années d'expérience dans la lutte contre le paludisme et qui va nous édifier à ce sujet. J'espère que pour les participants qui ont du mal à nous entendre, ça va déjà mieux. Nous vous prions de checker votre connexion Internet et vous rassurer que vous êtes dans une bonne zone. Je vais de ce pas passer la parole au Dr. Scott Filler pour sa présentation. Merci.
The Global Fund is a worldwide partnership to defeat malaria, HIV, and TB, but you may not know that we are also founded on a commitment to advance gender equality. Our commitment to gender equality has remained unwavering over the last 20 years. It leads to better health outcomes and is simply the right thing to do. Our current strategy has gender equality at its heart and recognizes that it is one of the key ways in which we will achieve our primary goal of ending malaria. We also have committed to gender transformative approaches, where we tackle the underlying causes in addition to addressing gender-related barriers to health services. This is more important than ever, given the significant pushback on gender equality taking place in many parts of where our partners are working, from bed nets to seasonal malaria chemoprevention to early diagnosis and treatment. The heart of malaria interventions are to protect individuals and the communities they live in. In order for these interventions to work, we need to ensure that everyone in the community is reached, regardless of age, gender, ethnicity, language, or economic status. As you all well know, malaria programs try to access the hardest to reach and to break down barriers preventing people using these life-saving services. Malaria does not discriminate. Anyone can be infected, but we know that young children and pregnant women can suffer more severe consequences, and thus it is critical the communities work together to ensure they are protected. Successful malaria control and eventual elimination can only come with everyone having access to life-saving tools. Malaria programs have understood this from the beginning. Women's empowerment within their homes and their communities leads to better outcomes for their children and families. Studies suggest where women have higher levels of decision-making power within a household, bed net use is higher, and when the gender gaps in education and health are smaller, malaria burden is lower. As such, malaria programs continue to engage, advocate, study, and innovate on gender-responsive and transformative programming to achieve better outcomes for the community they serve. Let me give you a few examples. For health campaigns and community healthcare provision, malaria programs work to have gender parity in the workforce to ensure those receiving services are comfortable interacting with their providers, but also working to ensure equal employment opportunities. Programs have worked with both men and women's group to understand health-seeking behavior and decision-making in order to facilitate early care, whether for a young child, a pregnant woman, or a male forest worker, and adapt service delivery programs to address any barriers. Malaria programs can bridge the gaps in gender equity and equality, but they cannot do it alone. As fever is often the main reason for seeking care through primary healthcare services, fever can often end up being malaria, gender-responsive programming in primary healthcare services is imperative. There are two prerequisites for malaria programs to be able to help bridge the gap. A primary one being political will. Governments need to ensure there is a legal framework, resources, capacity, and advocacy for addressing issues related to gender equity and equality in and beyond healthcare and health. For instance, policies to ensure for equal pay for equal work from community to senior leadership levels, ensuring leadership positions consider gender, funding empowerment efforts within and beyond health, and ensuring collaboration across ministries. A second main area is community advocacy and practice. While it is critical to have a political framework, if communities, households, and individuals do not or cannot embrace, engage in, and advocate for gender transformative policies, change cannot happen. The Global Fund recognizes the critical importance of the role of community in strengthening malaria and overall health system response, and ensuring programs, interventions, activities are gender-based. We encourage all of our programs and health system stakeholders to consider their approaches and adapt them to the national and local context, using community input to identify potential issues as well as propose solutions. While we encourage programs to engage with civil society organizations, they don't really need that encouragement, as most national malaria programs recognize the key role community actors play in the fight against malaria. So what is the Global Fund specifically doing to encourage a focus on gender equality? I'd like to share with you 4 key initiatives. First, we have supported the development and use of the Malaria Matchbox tool, an equity assessment tool to support the effectiveness of malaria programs. Second, we have rolled out a new gender equality marker across all of our grants, including the malaria grants, to assess, track, and improve the extent to which gender equality fundamentals are considered and addressed within the grants. Third, we have created a new gender equality fund to get funding directly to communities and civil society to advance their gender equality in their communities. And finally, we have instituted a new gender equality key performance indicator at the Global Fund, reported every year to our board, to monitor progress and to hold ourselves to account for progress on gender. So in closing, the message I would like to leave you is that malaria programs cannot achieve health equity and gender equality alone. We need communities to continue to demand it and for their voices to be listened to and acted upon by decision makers. If we are able to make gains in equity and equality, we will see these gains in the fight against malaria.
Nous remercions énormément le Dr Scott pour sa présentation et comme nous l'avons dit précédemment, juste après la présentation de Mme Abena de MMV, cette approche est de plus en plus sollicitée, de plus en plus recommandée afin de se rassurer que tous les besoins des communautés vulnérables sont réellement pris en compte. Donc, nous sommes très heureux que le Fonds mondial ait pris le lead sur cet aspect et travaille depuis des années au respect des droits des communautés et des gens et surtout comment s'assurer d'une réelle prise en compte effective du genre dans la lutte contre le paludisme. Donc, c'est à travers son speech que le Dr Scott Filler a voulu nous édifier sur ce que fait déjà le Fonds mondial depuis des années et c'est que le Fonds mondial a à le faire pour les années à venir. Donc, nous espérons que les programmes pourront prendre en compte ces différentes recommandations et ces différentes suggestions du Fonds mondial et que dans la mise en œuvre des programmes et des interventions au niveau national, au niveau régional, on va de plus en plus mettre en avant l'aspect genre, l'aspect respect des droits humains dans la lutte contre le paludisme. Sans plus tarder, je passe un panéliste qui est un keynote speaker qui va nous édifier toujours sur le même sujet, mais avec un accent sur comment est-ce qu'on peut mieux prendre en compte le genre, surtout pour la femme qui est surtout la femme enceinte qui est l'un des groupes les plus vulnérables, les femmes qui sont généralement lésées pour compte dans la lutte contre le paludisme. Et à ce propos, dans la suite de notre agenda, nous aurons un panel sur comment faire pour ne laisser personne de côté dans l'accès et l'utilisation des services de lutte contre le paludisme. Donc, sans plus tarder, je vais passer la parole au Dr Corinne Karima qui va nous édifier sur cette thématique du paludisme et du genre avec un accent sur comment faire pour mieux prendre en compte les besoins des femmes dans la lutte contre le paludisme. Merci.
Ladies and gentlemen and esteemed members of the Civil Society for Malaria Elimination, I'm Corinne Karema, Director of Malaria and NTD, Global Health at the Quality and Equity Healthcare. First of all, I would like to thank CS4ME for the invitation to participate in your annual forum, and I congratulate you for your commitment and engagement in malaria elimination, and thank you for your collective efforts. We are seeing how civil society for the malaria community has grown and is playing a critical role in the fight against malaria. And that is why today's theme on World Malaria Day is advancing health equity, gender equality, and human rights to end malaria. And we stand at a crossroads in our enduring battles against malaria. This year's theme is not just a call of action, but just a profound acknowledgement for the road to eradication is paved by the principle of justice and equality. You all know that women, often the primary caregivers, are also disproportionately impacted by malaria. They bear the brunt of the disease, which in turn imposes an unfair burden of their health, their family, and their ability to contribute to the community. When a mother suffers from malaria, the impact echoes through the whole family, affecting the education and well-being of the next generation. Furthermore, in many regions, like my region in Africa, women face significant barriers to accessing healthcare, owning land, and having financial independence, which limits their ability to seek timely treatment or invest in preventive measure. It's a gender gap that has dear health implications, and we have gathered here to close this gap. The Civil Society for Malaria Elimination, as I said earlier, has been pivotal in this fight, fostering programs that reach women in the most areas and empower them through education and resource provision. By ensuring that every woman and girls has access to long-lasting insecticide-treated nets, diagnostic treatment, prophylactic treatment, and reproductive care, we can make a stand for gender equality. Moreover, we must spotlight and celebrate the tireless efforts of female health workers and researchers pushing the boundaries in malaria prevention and treatment. These remarkable women are not just part of the workforce. We all know our community health workers. They are also leaders and innovators, yet the representation in decision-making spaces remain limited. So our responsibility is to elevate voices, women voices, and ensure that they are heard in the forum where policy and program are shaped. And that's why I really thank you for inviting me, and I know there are many women that are going to be part of this forum. So as we observe this World Malaria Day, let us pledge to unfold the rights of each individual, regardless of gender. Let us commit to dismantling the societal and structural barriers that impede our progress towards malaria eradication. In the wise words of Helen Keller, alone we can't so little, together we can do much. So together with the Civil Society for Malaria Elimination, we can redefine the future, a future where no woman, no man, no girl or boy will suffer from the scourge of malaria. Our mission is clear, and the civil society determination is unwavering. Let us march forward with a conviction that our collective action will be the downfall of malaria. So I thank you for your commitment, your passion, and belief in a world where health equity is the norm, not the exception. So let us continue the fight, not just today, but every day, until we have conquered malaria for all, once and for all. Thank you very much.
Un grand merci au Dr Corinne Karema pour son intervention, très, très édifiant. Et nous sommes très heureux de pouvoir d'avoir eu l'honneur de sa présence à notre traditionnel CS4ME Annual Forum qui se tient chaque année depuis déjà pratiquement 4 ans. Nous sommes à la 4e édition. Et Dr. Corinne Karima s'est attardée sur un aspect très important, c'est vraiment l'inaccessibilité, mais le manque d'accessibilité financière des femmes pour pouvoir bénéficier des services adéquats de lutte contre le paludisme. C'est encore un gros problème dans la plupart de nos communautés, surtout en Afrique subsaharienne et même dans certains pays d'Asie du Sud. Et nous sommes heureux de pouvoir de nous assurer que ces problèmes qui sont généralement communs à plus d'un pays sont discutés dans les grandes instances de lutte contre la maladie. Également, il y a cet aspect de représentativité de la femme dans les instances de prise de décision qui est vraiment limité et Dr. Corinne l'a bien soulevé. Et il est important pour nous de pouvoir sensibiliser, de pouvoir travailler pour nous, acteurs de la société civile, partenaires techniques et financiers, pour que les femmes soient plus représentées dans les instances de prise de décision, dans les CCM, les communautés nationales rollback malaria et toute autre instance où on prend, où les sujets majeurs et les grandes décisions de la lutte contre le paludisme sont prises, que ce soit au niveau local, au niveau national ou au niveau régional. Donc, merci une fois de plus encore, Dr. Corinne Karima, pour ta présentation. Et je vais de ce pas introduire le prochain panéliste, qui est M. Éric Fleutelot, qui est le directeur du département santé de l'unité Expertise France. M. Éric Fleutelot va également s'entretenir avec nous sur le lien entre le genre et la lutte contre le paludisme, avec un accent toujours sur les limites ou bien les problèmes d'accessibilité rencontrés par les communautés vulnérables aux services de lutte contre le paludisme, surtout aux services efficaces de lutte contre le paludisme. Donc, sans plus tarder, on va passer la parole à M. Éric Fleutelot pour son intervention. Merci.
Bonjour à toutes et à tous, je suis Éric Fleutelot, je suis directeur technique du département santé d'Expertise France et je dirige le pôle Grande Pandémie où se trouve l'initiative qui vient en appui à la lutte contre le paludisme. Aujourd'hui, on fait face à un paradoxe. Le paradoxe, c'est que le paludisme, c'est une maladie qu'on peut prévenir, que l'on peut guérir, et pourtant, chaque année, des dizaines et des dizaines de millions de nouveaux cas sont dénombrés et entre 600 et 700 000 personnes en meurent. L'impact de la pandémie de paludisme, il est donc très important en matière de santé mondiale, mais il y a d'autres facteurs d'inquiétude comme la propagation des résistances, que ce soit les résistances aux traitements antipaludiques ou aux insecticides utilisés dans la lutte antivectorielle. Or, en matière de paludisme, comme sur bien d'autres sujets de santé mondiale, la perspective de genre doit être mieux prise en considération. Tout d'abord parce que sur le paludisme, comme sur d'autres sujets de santé, les inégalités de genre se rejouent. L'accès aux soins, la qualité des soins prodigués, l'observance des mesures de prévention et de traitement font face à des obstacles qui ne sont pas les mêmes pour les hommes et pour les femmes. Les normes sociales, les croyances, les freins financiers, les contraintes familiales et professionnelles ne s'expriment pas de la même façon pour les hommes et pour les femmes, pour les populations rurales et pour les populations urbaines. C'est presque une banalité que de rappeler qu'il existe une forte disparité de genre face au paludisme, pas tant sur l'incidence, mais plutôt sur les cas graves et la mortalité. En effet, les personnes les plus à risque de décès dus au paludisme sont les enfants de moins de 5 ans, sans que là il y ait de véritables différences entre les petites filles et les petits garçons, et les femmes enceintes. En revanche, on constate que le poids de la prévention, du diagnostic, de la prise en charge du paludisme repose de façon disproportionnée sur les femmes. On a ainsi observé que les mères ont tendance à faire dormir leurs enfants de moins de 5 ans sous une moustiquaire, et ça sans distinction, garçons ou filles, mais lorsque les enfants grandissent, on se rend compte que les garçons sont moins protégés. Par ailleurs, certains hommes refusent encore, dans certains pays, dans certains contextes, les pulvérisations intradomiciliaires par peur, soi-disant, de perdre en capacité sexuelle. Or, il s'agit d'une bonne pratique que d'utiliser les séances de consultation. S'il s'agit, d'une bonne pratique que d'utiliser les séances de consultation prénatale pour assurer la prévention du paludisme chez les femmes enceintes, il conviendrait sûrement de mieux intégrer les hommes, notamment dans l'utilisation effective des moustiquaires imprégnés à longue durée d'action. Il convient donc de prendre en considération certaines activités qui exposent davantage les femmes aux moustiques, par exemple lorsqu'il s'agit d'aller vendre au marché en partant très tôt, petit matin, lorsqu'il fait encore nuit, ou lorsqu'il s'agit d'aller chercher de l'eau dans des situations où les risques de gîte larvaire sont plus grands. Mais en miroir, on voit que les hommes sont exposés également dans des situations qui leur sont spécifiques, telles que les travaux, là encore tôt le matin, alors qu'il fait encore nuit, dans les champs, avec des habits moins couvrants, ou bien des travaux dans les forêts ou dans les mines, à des heures où les moustiques sont encore actifs. En clair, les femmes et les hommes sont exposés au paludisme, mais souvent pour des raisons, des contextes différents qu'il faut prendre en compte, notamment dans les stratégies de prévention et bien entendu dans les messages de sensibilisation et dans la communication. Enfin, il faut rappeler que si le poids du dépistage et la prise en charge repose encore trop traditionnellement sur les femmes, ce sont elles qui peuvent rencontrer des barrières économiques, les empêchant d'emmener un enfant ou un autre membre de leur famille vers les structures de santé, qui, notamment en zone rurale, sont trop éloignées des populations. Donc, discuter des obstacles spécifiques auxquels sont confrontées les femmes en matière d'accès aux soins de santé et de prévention du paludisme, tels que les barrières économiques, les barrières culturelles ou géographiques, apparaît donc primordial. J'ai évoqué en tout début le fardeau disproportionné que le palud impose aux femmes, en particulier aux femmes enceintes ou aux jeunes enfants, mais il faut aussi parler des conséquences sociales, économiques et sanitaires de l'incidence élevée du paludisme. La maladie va jouer ici un rôle dangereux d'appauvrissement de la famille, en engendrant des coûts pour l'accès aux services de santé, tout en réduisant la capacité de générer des revenus, et ça aussi bien chez les femmes que chez les hommes. De nombreuses initiatives de lutte contre le paludisme prenant en compte le genre peuvent être développées et c'est ce à quoi nous nous attachons à faire à l'initiative, à une facilité qui est mise en œuvre par Expertise France. On veut aujourd'hui que les programmes et les politiques intègrent une perspective de genre dans la lutte contre le paludisme, avec par exemple, très concrètement, une distribution équitable de moustiquaires imprégnés d'insecticides, l'accès aux tests de dépistage et aux traitements, ainsi que l'éducation sanitaire adaptée aux besoins spécifiques des femmes et des hommes en fonction de leurs activités qui les mettent les plus à risque d'être en contact avec les moustiques et donc avec le parasite Plasmodium. La remise en cause des normes sociales qui retardent parfois la consultation chez un médecin. Je pense à l'exemple des hommes qui doivent toujours se montrer forts et résistants, alors que s'ils consultaient dès les premiers symptômes, on pourrait plus facilement les guérir et éviter une évolution vers un paludisme grave. Enfin, proposer des postes de dépistage avancés dans les zones les plus à risque, auprès des travailleurs forestiers, par exemple, lors des horaires de travail ou lors des consultations prénatales si la femme enceinte ou son jeune enfant se présente des symptômes caractéristiques, offrir une possibilité de visite médicale à domicile. Il y a plein de choses à inventer pour aller au-devant des besoins des personnes de façon spécifique pour les femmes et les hommes. Renforcer l'équité de genre dans la recherche et les politiques, c'est indispensable, c'est vraiment un socle. Enfin, il faut souligner l'importance de la collecte et de l'analyse des données qui soient désagrégées, ventilées par sexe pour mieux comprendre les disparités de genre liées au paludisme, car elles peuvent être différentes d'une région à l'autre, d'un pays à l'autre. Enfin, on ne peut qu'encourager l'élaboration de politiques et de stratégies de lutte contre le paludisme qui prennent explicitement en compte les différences de genre et qui visent à réduire les inégalités qui sont liées à ces différences. En conclusion, le sujet de la prise en compte du genre est avant tout un enjeu de qualité. C'est vraiment, il faut avoir ça en tête. L'intégration de l'approche genre, c'est un enjeu de qualité des programmes de santé, c'est un enjeu de qualité des programmes de lutte contre le paludisme, c'est une manière d'améliorer les stratégies de prévention et de prise en charge en proposant des approches différenciées, mais aussi c'est une manière de venir remettre en cause certaines normes sociales et relations de pouvoir qui peuvent être à l'œuvre dans l'ensemble des sociétés pour réduire les souffrances des populations les plus vulnérables. Et je vous remercie de nouveau de m'avoir convié à votre réunion.
Un grand merci à M. Eric Fletelo pour son intervention. Vraiment, je pense qu'il a brossé tout ce que les prédécesseurs ont évoqué sur cette présentation. Ici, je vais peut-être m'attarder sur quelques points sur lesquels M. Eric Fletelo a évoqué, en commençant peut-être par les derniers points, sur l'importance de collecter les données. Collecter les données de qualité et surtout désagréger pour présenter de manière claire quel est l'impact de la maladie et la différence entre comment la maladie touche aussi bien les femmes que les hommes. Et cette collecte de données aura un impact sur l'établissement, bien l'élaboration des politiques, des programmes qui vont s'imprégner et bien qui vont prendre en compte le genre. Très important pour s'assurer que une réelle prise en compte, une réelle, on dit souvent chez les, je sais pas, je voulais paraphraser un peu M. Fletelo, pour que les populations, les laissés pour compte soient de plus en plus mises en avant dans la lutte contre la maladie. Et ici, c'est important de pouvoir se rassurer de la mise sur pied des initiatives qui vont promouvoir le genre, qui vont promouvoir le respect des droits humains pour que, et on réduise les disparités dans la prise en charge et même dans la prévention de la maladie au niveau communautaire jusqu'au niveau national. Il a évoqué quelque chose de très édifiant pour nous, c'est le fait que le poids de la prévention du paludisme repose sur la femme. Dans pratiquement toutes les communautés, nous constatons que c'est généralement des femmes qui prennent plus les initiatives pour mieux lutter contre le paludisme, mais elles ne sont pas toujours bien prises en compte lorsqu'il faut décider d'une politique afin de lutter contre le paludisme au niveau national ou au niveau régional. Donc, il est très important de pouvoir de plus en plus mettre en avant les femmes dans ce sens-là. Donc, nous allons vraiment dire un grand merci à M. Fletelo pour sa présentation et permettre aux uns aux autres, chers participants, de pouvoir échanger. Nous allons ouvrir la parole pendant quelques minutes pour qu'on puisse échanger sur le sujet. Qu'est-ce que nous, en tant qu'acteurs de la société civile, pouvons faire pour se rassurer d'une réelle prise en charge, d'une réelle prise en compte du genre dans la lutte contre le paludisme? Donc, la question est ouverte et n'hésitez pas à lever la main pour pouvoir répondre à cette question. Nous avons déjà quelques mains levées. Je vais demander le support de mes collègues pour pouvoir permettre aux panélistes, aux participants de répondre à la question posée. Je vois déjà M. Babacar Thiam qui a levé la main. On va vous accorder la parole pour que vous puissiez répondre à la question. Merci. M. Babacar Thiam, vous pouvez ouvrir votre micro et parler.
Oui, fidèle.
Oui, nous vous écoutons.
Allez-y, bonjour.
Bonjour à vous.
Merci beaucoup. Merci. Je remercie toute l'équipe de CS4ME et tous les panélistes qui ont fait des présentations de qualité. Vraiment, c'est des présentations que j'ai suivies avec intérêt. Tout est centré sur la problématique du palu et qui est une problématique partagée par tous les pays. Je voudrais simplement mettre l'accent en lien avec la thématique du forum, c'est-à-dire les questions de genre, équité dans le cadre de la lutte contre le palu. Je suis dans une réunion où on est en train d'élaborer une note conceptuelle qui va prendre en compte quelques régions du Sénégal, là où vraiment, avec le programme PNLP, des efforts énormes ont été centrés sur la préélimination. C'est-à-dire vous dire qu'aujourd'hui, cette préélimination est de vigueur et est un sujet qui est pris en compte par les organisations de la société civile. Je voudrais à ce titre, aujourd'hui, il y a des initiatives novatrices au niveau de mon pays, c'est-à-dire le Sénégal, à savoir l'investigation communautaire. Le cas index aujourd'hui, c'est-à-dire un cas détecté, comment faire pour davantage impliquer la société civile au niveau communautaire pour que ce cas indexé ne puisse pas être un cas contaminateur par rapport à la pandémie. Et ça, vraiment, c'est une initiative qui est très encouragée. L'autre élément, c'est le suivi communautaire. Aujourd'hui, au niveau du pays, une phase pilote dans le cadre du suivi communautaire, le SLM, est en train d'être expérimentée. Les résultats escomptés ont permis aujourd'hui d'engranger vraiment un travail énorme et l'extension sera faite dans d'autres régions. Pour dire qu'aujourd'hui, malgré l'évolution de la pandémie dans d'autres régions, on connaît dans le pays des régions aujourd'hui qui n'ont presque pas de cas de palu annuellement. Pas de palu annuellement. Et ça, c'est encourageant. L'autre aspect, comment faire les badjonugors, c'est-à-dire comment ça s'appelle la traduction en français, c'est-à-dire les marraines, donc les mères qui sont choisies par leur engagement, par leur accompagnement, par leur esprit d'ouverture, et ainsi de suite. L'implication de ces dernières dans le cadre de la réponse au palu a permis de booster et de donner des résultats favorables. C'est pour encore une fois dire la perspective genre doit être nécessairement prise en compte au niveau des plans stratégiques, au niveau des plans opérationnels, mais également au niveau de l'engagement communautaire à travers donc tous l'investissement que la société civile est en train de faire. Je me limite par là et saluer vraiment la qualité des débats, la qualité des présentations. Je vous remercie.
Merci beaucoup, mon cher Babacar, pour ton intervention. Très important, effectivement. Dans l'élaboration des politiques que nous faisons en ce moment, il est essentiel qu'on puisse déjà tout en plus prendre en compte le genre dans la mise en œuvre des interventions majeures de lutte contre le paludisme. Ce n'était pas quelque chose qui était beaucoup mis en avant par le passé. Et nous sommes heureux d'apprendre que de nombreux pays font déjà cela dans le cadre de l'élaboration de soit de leur plan stratégique, des plans de travail annuels, ainsi de suite. Toutes les politiques qui sont mises en œuvre, qui sont planifiées au niveau étatique pour pouvoir lutter contre le paludisme. Il est vraiment primordial que l'aspect genre puisse être pris en compte dans cela. Je vais de ce pas donner la parole à Madame Laurentine Voué. S'il vous plaît, Madame Laurentine Voué, vous pouvez juste ouvrir votre micro et nous donner votre opinion. Merci. Madame Laurentine, vous nous entendez? Vous pouvez ouvrir votre micro et nous donner votre opinion. Je pense que Madame Laurentine a certainement un souci de connexion Internet. On va donner la parole à Madame Beauclaris. Oui, Madame Clarisse, vous avez la parole. Vous pouvez juste ouvrir votre micro et nous donner votre opinion. Merci.
Bon, j'espère que vous m'entendez.
Très bien.
Bon, ce que je voulais dire, hein, j'ai bien suivi et je félicite, je remercie beaucoup les expériences qu'on nous a données par rapport à la prise en compte des organisations de société civile dans la lutte contre le paludisme. Moi, c'est Madame Beau-Clarisse de la RDC. Je m'occupe des activités de lutte contre le paludisme dans la communauté. Donc, je me suis dit, peut-être pour donner aussi un input, l'exemple de la RDC, avec Impact Santé Afrique, nous avons formé les organisations de société civile pour faire le plaidoyer. Et parmi lesquelles, nous avons privilégié les ONG des femmes, où il y a l'émergence des femmes. Par exemple, c'est vraiment très important de faire une cartographie des ONG des femmes qui sont bien compris et qui facilitent aussi, comment dire, ici dans notre pays. On dit quand on édite une femme, on édite une nation. Et avec cette expérience-là, l'ONG des femmes qui vont nous aider à faire la sensibilisation, surtout pour les leaders religieux, pendant les journées mondiales de lutte contre le paludisme. Et c'est ce que je voulais peut-être ajouter comme un input pour, en dehors de tout ce qui a été dit, que nous vraiment partout où les ONG sont, il serait mieux qu'on fasse une cartographie des ONG des femmes. Surtout dans notre pays, nous facilite beaucoup à faire le plaidoyer au niveau de nos autorités politico-administratives. Merci.
Merci beaucoup, Madame Clarisse, pour votre intervention. Je vois que Madame Laurentine a déjà son micro ouvert. Madame Laurentine, vous pouvez prendre la parole si vous avez pour nous votre opinion. Puis nous allons passer la parole à Madame Ida Sabadogo. Madame Laurentine, vous avez la parole. Merci. Madame Laurentine, vous nous entendez? OK, je pense qu'on va directement passer la parole à Ida. Ida, s'il te plaît, tu peux juste ouvrir ton micro et prendre et nous donner ton opinion. Merci.
Ok, merci Fidèle. J'ai deux propositions pour répondre à la question. Que peut faire la société civile pour une réelle prise en compte du genre dans la lutte contre le paludisme? Nous voyons que les différents pays ont chacun son contexte socio-culturel qui a un impact sur la lutte contre le paludisme par rapport au genre. Donc, je voudrais faire une proposition qu'on mène une étude des contextes socio-anthropologiques dans les différents pays pour voir dans quel pays, quelles sont les situations qui impactent sur la lutte contre le paludisme, surtout au niveau des femmes. Parce que selon les présentations que nous venons de voir, nous voyons que l'aspect genre est vraiment à un taux important pour la réussite de la lutte contre le paludisme. Voir, par exemple, dans nos pays, qu'est-ce qui empêche la prise en compte vraiment de la lutte contre le genre concernant les femmes? Par exemple, chez nous, il y a des ethnies où la femme n'a pas le droit de se rendre dans un centre de santé sans l'accord de son mari, etc. Et il y a des ethnies aussi où ils n'acceptent pas que la femme puisse, je ne sais pas, dormir sous le moustiquaire. C'est l'homme, même si elle est enceinte, c'est l'homme qui prend le moustiquaire imprégné pour dormir là-dessus, etc. Donc, mener des études, ça va vraiment aider à pousser la lutte contre le palud dans nos pays. Deuxième proposition, c'est faire du plaidoyer. Après ces études, on pourra faire le plaidoyer basé sur les résultats de ces études, notamment le plaidoyer au niveau des leaders communautaires, tels que les leaders religieux et coutumiers, tels que nos leaders politiques, pour une meilleure prise en compte des approches culturelles, comment faire pour sensibiliser nos leaders pour que l'adhésion de la prise en compte du genre dans la lutte contre le paludisme puisse être effective. Merci.
Merci beaucoup, Ida, pour ton intervention, très édifiante, très importante. Nous avons encore malheureusement ces réalités dans certaines de nos communautés où la femme est mise en arrière, si je peux dire ainsi, et n'a pas vraiment beaucoup de pouvoir dans ce qui concerne sa propre santé ou bien d'autres aspects de la lutte contre la maladie. Et il est important qu'on puisse sensibiliser nous, acteurs de la société civile, acteurs communautaires, les responsables de famille, les leaders communautaires et toute autre partie prenante afin de pouvoir octroyer, bien donner beaucoup plus d'importance à la femme et la mettre au centre de la lutte pour mieux réduire les cas de paludisme et réduire le fardeau de la maladie dans nos communautés. Je ne vais, sans plus tarder, je vais passer la parole à Dr Ndia du Sénégal pour son intervention. Dr Ndia, vous pouvez juste ouvrir votre micro et nous faire part de votre opinion. Merci.
Oui, bonjour Fidèle, bonjour à tout le monde et merci pour cette opportunité d'échange très riche que vous nous avez donnée depuis ce matin. De grands experts nous ont gratifié de présentations très riches. Je voudrais compléter par rapport à la proposition de ma sœur Ida qui vient juste de parler. D'abord, pas pour défendre les hommes ou pour apostropher les femmes, mais sur ces questions de genre, aussi chez nous, on trouve aussi des communautés où ce sont les femmes qui sont réticentes à l'attachement de la moustiquaire dans la chambre pour des raisons esthétiques. Comme vous savez, les femmes sont très attachées à l'esthétique. Donc, ça aussi, il faut comprendre ces aspects-là pour pouvoir développer les bons messages. Et puis, comme contribution aussi, je voudrais dire qu'il y a un outil assez intéressant que les socio-anthropologues savent bien dérouler sur le terrain, le Malaria Matchbox Tool, qui permet de recueillir des informations importantes sur les questions de genre, les populations les moins bien servies, les plus exposés, etc. En tout cas, quand on écrivait le GC7, aussi bien au Sénégal, ça nous a beaucoup aidé, même le Burundi aussi, où moi j'avais été. Aussi, le résultat de cet exercice de malaria matchbox tool nous avait beaucoup aidé pour adresser les questions liées aux problèmes de genre. Voilà, donc je vous remercie et encore une fois, félicitations pour cette belle initiative. Merci.
Merci beaucoup, Dr. Ndia, pour votre intervention. Vous avez évoqué quelque chose de très important, le malaria matchbox, qui n'est pas toujours mis en œuvre dans tous les pays endémiques et que nous espérons, le RBM a beaucoup évoqué l'utilisation de cet outil qui permet d'identifier les barrières liées aux gens, aux droits humains que peuvent rencontrer les communautés vulnérables dans l'accès et l'utilisation des services, des produits et services de lutte contre le paludisme. Il est important qu'on puisse vraiment faire la promotion également de cet outil, très important, et demander aux différents programmes nationaux de lutte contre le paludisme de pouvoir le mettre en pratique pour les pays qui ne l'ont pas encore fait et se rassurer qu'on puisse identifier vraiment les barrières majeures dans l'accès et l'utilisation des services de lutte contre le paludisme. Donc, merci beaucoup pour votre intervention. Merci à tous ceux qui ont pris le temps de nous réagir lors de cette session de discussion. On va prendre une petite pause et revenir d'ici quelques minutes pour la suite de notre forum. Ne vous éloignez pas. On va juste prendre le temps de souffler 5 minutes et revenir.
15 minutes, fidèle.
Ok, 15 minutes. Revenir pour la suite qui est tout aussi riche et palpitant avec des interventions des acteurs et des leaders de la société civile africaine et asiatique qui vont nous édifier sur des thématiques toujours en lien avec le paludisme et le genre. Donc, après ces 15 minutes de pause, nous on va revenir pour la suite. Merci.
Oui, merci à tous. Et juste pour ajouter, vous avez l'outil Malaria Matchbox sur le site CS4ME, ainsi que des webinaires sur comment utiliser cet outil. Donc, sur le site CS4ME, vous allez trouver tous ces outils-là et on va prendre le soin de vous renvoyer le lien où vous allez voir tous ces outils qui sont très importants. Donc, à tout à l'heure dans 15 minutes. Merci.